The Committee on Energy and Commerce will now come to order. Today, the committee is holding a hearing entitled Addressing the Urgent Needs of Our Tribal Communities. And due to the COVID-19 public health emergency, today's hearing is being held remotely. All members and witnesses will be participating via video conferencing. And as part of our hearing, microphones will be set on mute for purposes of eliminating inadvertent background noise. Members and witnesses, you will need to unmute your microphone each time you wish to speak. Documents for the record can be sent to Rebecca Tomilchik at the email address we provided to staff, and all documents will be entered into the record at the conclusion of the hearing. And I recognize myself now for 5 minutes for an opening statement. Let me find my opening statement here, now that I've said that. I believe that today's hearing is long overdue. Day after day, our nation's tribal communities are suffering terrible inequalities, unequal access to safe drinking water, unreliable access to the energy grid, little or no broadband connectivity, unreliable funding from the federal government, and other systematic problems that have created unnecessary hardship and turmoil. And now COVID-19 is exacerbating many of these long existing problems. More than 1/3 of tribal members are at high risk of serious COVID-19 complications due to underlying health factors, and Navajo Nation has seen higher infection rates than those in Wuhan, China during the peak of the pandemic. Despite this stark reality of the impact of COVID-19 on tribal communities, we've heard repeatedly about the struggles of tribal communities in accessing the personal protective equipment and testing needed to protect against COVID-19. As this pandemic rages on and COVID-19 cases continue to rise in many areas of the country, access to PPE and testing, as well as access to proper sanitation and well-equipped health facilities, will be critical to flattening the curve for tribal communities. And our tribal communities deserve better. That's why we're here to listen to representatives of tribal governments and organizations so we can ensure Congress meets its obligations to tribal governments and communities. While I'd like to believe that we have made incremental improvements for tribes over the years, it's clear that not enough has been accomplished. In the area of healthcare, as I noted, tribal communities experience greater health disparities compared to other groups, which increases their risk of hospitalization due to COVID-19 and associated complications. We have to tackle the fact that the Indian Health Service remains chronically underfunded. It's impossible for IHS to meet the healthcare needs of tribal members, whether in a pandemic or not, without sufficient and stable resources, which has contributed to outdated infrastructure and medical equipment. And while Congress has provided increased resources to IHS in recent coronavirus packages, the administration has failed to get this money to tribal communities swiftly, putting tribal members further at a disadvantage in receiving the testing, PPE, and healthcare access they need in order to respond to COVID-19. The Moving Forward Act includes $5 billion for IHS and tribal recipients for the construction and renovations of hospitals and outpatient care facilities. I also look forward to hearing about what the federal government can do to make sure all tribal communities have access to high-speed internet service. As you know, the pandemic has driven home how internet connectivity is essential for everyone. Telehealth services are vitally special in remote areas. Distance learning is the only option for many, and telework and e-commerce are growing in importance. Yet for all its benefits, 2/3 of people living on rural tribal lands have no internet connectivity, which I think is a disgrace. Unfortunately, the Moving Forward Act also brings more connectivity to tribal households by providing $80 billion for broadband deployment projects. Electricity and water access on tribal lands also continues to be a major issue, and tribal households are less likely to have access to indoor plumbing and a safe water supply. And the Moving Forward Act addresses these issues by investing $47 billion in drinking water, including the Indian Reservation Drinking Water Program, and $50 million to improve tribal communities' access to affordable and reliable energy sources. So I just want to say that we would like to bring more renewable or other energy production to tribes and have to look forward to ways to encourage moving in that direction. So I wanted to give half of the time left to both Representative Ruiz and O'Halloran. I know there's not a lot left, so maybe we'll give we'll start with Representative Ruiz. You got like 30 seconds, and then we'll give it the other 30 to Tom.
Absolutely. Thank you. Thank you, Mr. Chairman, for holding this important and historic hearing to address the needs of Indian country. We've been working on this tribal issues together for years now, including on the Indian Health Service Task Force, along with our friend on the other side of the aisle, Congressman Mullen. And I am pleased that we are having this critical hearing and appreciate your leadership on tribal issues, which I have been working on since long before I came to Congress. Tribal nations have long suffered from massive underfunding and a scarcity of resources, and the COVID-19 pandemic only amplifies the disparities that are a result of the lack of funding. During this Congress, reports commissioned by myself and the chairman expose challenges Indian country faces, including access to broadband inequities and failures in tribal consultation process within the Superfund program. That's not to mention the drastic health disparities in Indian country. So I'm looking forward to discussing all these issues further during today's hearing and further markups and in the coming months. Thank you, Mr. Chairman. I yield back.
Tom, there's only a few seconds left. You want to say something? I'm sorry. Tom? Or maybe he's not on?
Oh, he's on. Historically, federal policy has unacceptably left the needs of the Native American communities behind. President Nez and I have been working together to address how the Navajo Nation and people have been left behind and develop bold public policies needed to rectify this. I thank the chairman and all the members of the committee for recognizing in the bills that we put forward the needs of tribal lands, and we can do so much more. Thank you.
Thank you, Tom. And I'm going to now recognize Mr. Waldman for 5 minutes, but if you want to give an extra 30 seconds to Mark Wayne, because we gave an extra 30 to Tom, Greg, it's up to you. Greg?
Yeah. Mr. Chairman, I think he was going to yield 2.5 minutes to me and 2.5 minutes to Representative Giaforte.
Oh, okay, great. So I recognize Mark Wayne Mullen.
Okay. Well, now I'm not ready, so you got to give me just a second because I left my notes on my phone.
Sure.
Well, first of all, thank you, Chairman, and thank you for all the chairs and ranking members of the full committee and the Health Subcommittee for listening to my concerns and having this important hearing. As was addressed earlier, I think this is the first time in my time, definitely on the committee, that we've had a full committee hearing on Native American issues. And Native Americans deserve quality and reliable health care services as promised by the federal government. In fact, it's the only federal obligation for healthcare that we have out there. As a Cherokee, I grew up going to tribally ran hospitals. At Hastings, which is just down the road from me, in Tahlequah, was where I received my healthcare, and I understand how important that operating these direct services and facilities are to tribal members. Last Congress, I was fortunate enough to co-chair the IHS task force, which led up to several key areas in which we can improve healthcare and improve care to over 2.2 million Native Americans. IHS is not only terribly underfunded, but it's also the only federally healthcare agency who doesn't receive mandatory or advance appropriations. We have to fix that. IHS must also be modernized. Its IT system needs to be brought into the 21st century. There's so much going on in Indian country that applies to this committee, and we need to take a deeper dive. Again, Chairman, I want to thank you for holding this hearing. I urge my committee to continue this process with additional hearings on in health and on oversight and investigation subcommittees. And with that, I'll yield the remainder of my time to the gentleman from Montana, Representative Greg Giaforte.
Well, I want to thank the gentleman from Oklahoma for yielding. I appreciate his leadership on the Indian Health Service Task Force last Congress. Well done. I've long asked that we hear from Indian country, and I'm glad, Mr. Chairman, we're having this hearing today. Native Americans make up nearly 7% of Montana's population and more than 2% of the U.S. population. I was proud to finally pass legislation restoring federal recognition to the Little Shell tribe of the Chippewa Cree in Montana last year. That was long overdue. Federally recognized tribes enjoy a nation-to-nation relationship with the U.S. government. This recognition allows tribes to access critical resources for economic development, healthcare, and education, and regulate affairs on tribal lands. These resources often come with complicated federal procedures. We need to better understand these challenges to increase opportunity for these communities. During the COVID-19 pandemic, Americans rely on broadband connection for their daily activities. Broadband is essential for business, education, and telemedicine. Many tribal lands in the United States are among those areas in our country that lack adequate broadband access. Each tribe has unique challenges for deployment, from rough terrain to complicated and expensive federal permitting regimes. Last month, I joined with Republican members to introduce legislation that will help streamline some of those reviews, making it easier for companies to deploy broadband infrastructure and close the digital divide. Additionally, the FCC offered tribes near early access to the 2.5 gigahertz band in order to ensure that tribes could obtain spectrum licenses. While these are great first steps, we must do more to close this digital divide. Also, key to tribal nations is energy, access to it, as well as the ability to develop, produce, and sell it. Many tribal nations are rich in resources that they use for energy development and production. In my home state of Montana, the Crow tribe produces coal and faces challenges exporting it. One of our witnesses today, the Chairman Sage of the Southern Ute Indian tribe, the Southern Ute are engaged in oil and gas production on and off the reservation. These energy resources are economic drivers and fund investments in other businesses for the tribes. Not all tribal lands have these types of resources and services developed and are readily available. Still, many have issues with access to electricity and safe drinking water. We need to understand how to address these challenges. I look forward to this important discussion today. Thank you, Mr. Chairman. With that, I yield back.
Chairman, you're on mute.
Okay, so I just wanted to remind everyone that pursuant to committee rules, all members' written opening statements will be made part of the record. And now we're going to go to our witnesses for today's hearing. And I wanted to recognize Mr. O'Halloran to introduce our first witness, the president of the Navajo Nation. Tom? Is Tom there? Can you guys hear me?
I can hear you, Mr. Chairman. Not sure what happened to Tom.
Is Mr. O'Halloran? Oh yeah, I don't see his picture. Tom, are you there? I think you're on. Maybe you need to unmute, Tom, but I don't see your picture either. Oh, there he is.
Thank you, Mr. Chairman. President Jonathan Nez has served as a tireless leader of the Navajo Nation and is now committed public servant of the Navajo people. He has served in all offices of the Navajo Nation. He fully understands the scope of the challenges facing the Navajo Nation and Indian country. The realities of life on the Navajo Nation is harsh. And in many places, as you indicated earlier, there's a lack of water, electricity, and the basic needs of life. And join our efforts to ensure that the federal government lives up to the treaty and trust obligations that it has. Thank you.
Thank you. And then we are also going to hear from the Honorable Christine Sage, who's chairman of the Southern Ute Indian Tribe, and from Fawn Sharp, who's president of the Quinault Indian Nation and who is testifying today as the president of the National Congress of American Indians. And then I'd like to introduce now Mark Wayne Mullen to introduce Dr. Charles Grimm, if you would.
Thank you, Chairman Plone. I am actually really honored to introduce this fellow Cherokee. He is an accomplished healthcare professional, and as I said, he's a fellow Cherokee, Dr. Charles Grimm. Dr. Grimm has decades of experience with IHS, including as a director of IHS under President George W. Bush. He spent years leading the health services for the Cherokee Nation and is now the Secretary of Health for Chickasaw Nation. He is also a retired Assistant Surgeon General and Rear Admiral in the Commission Corps of U.S. Public Health Services. He is a native native doctor, and who has dedicated his life to serving Indian country. And I'm very proud to have him here representing the great state of Oklahoma. Dr. Grimm, thank you so much for being here today.
Thank you. And then our last witness is Pilar Thomas, who's a partner in Quarles and Brady. So let's start with President Nez. President Nez, you're now recognized for 5 minutes for your statement. Thank you.
Thank you, and Chairman Pallone, Ranking Member Walden, and members of the Committee on Energy and Commerce. And thank you, my friend Tom O'Halloran, for that introduction. My name is Jonathan Nez. I am the president of the Navajo Nation, and Vice President Myron Lizer and I greet you today. We appreciate this opportunity to testify before the full committee today to address urgent needs facing the Navajo Nation. And many of these same issues are being affected by the 573 other tribes throughout the country. The Navajo Nation is going through some tough times right now, as the chairman mentioned. And I appreciate the prayers and support that have been given by our congressional delegation and Congress. Thank you so much. Today, I'm going to be talking about water, electricity, and broadband infrastructure. Of course, this committee oversees many other jurisdictions throughout the United States. And for the 5 minutes, I think water, electricity, and broadband will be our focus. But before I begin those comments, I would like to start with a COVID-19 update on the nation, on the Navajo Nation. As of yesterday, July 7th, 5 p.m., I received a report from our epidemiology team. There are a total of 7,941 confirmed COVID-19 positive cases. You know, we are also tracking the recovery numbers. So 5,650 have recovered. We have lost 379 of our relatives here on the Navajo Nation. Please hold them in prayer. We have tested over 60,000 individuals since this crisis entered our borders. And we have been testing very aggressively. And this shows that 29.4% of our total population have been tested. For almost 2 months, the Navajo Nation saw the highest per capita COVID infection rate in the U.S. But right now, per capita, we are testing more of our citizens than any state or matter of fact, any country, many of the countries throughout the world. As a result of the chronic underfunding of Indian programs, which was mentioned earlier, tribes were not equipped with prompt and adequate resources to respond to COVID-19. For example, CARES funding did not fully reach the Navajo Nation until 3 months after Congress intended. Again, I deeply appreciate the committee for convening this hearing today to shed light on these matters and for hearing our most urgent needs. And in terms of water, there is no greater need on the Navajo Nation than clean drinking water, where more than 40% of the Navajo Nation households do not have running water. Access to safe drinking water and sanitation facilities are an extension of primary healthcare delivery. Legislation H.R. 756, introduced by Congressman O'Halloran and Congressman Young, is a great step toward providing safe drinking water to our Navajo people. In addition, the House should pass the Navajo-Utah Water Rights Settlement Act, which the Senate unanimously passed as part of Senate 886. Under this bill, the Navajo Nation would receive approximately $220 million in federal and state funding for desperately needed drinking water infrastructure. Further delaying the passage of Senate 886 will continue to deny clean drinking water to the Navajo people. The Navajo Nation has waited decades for this day to come, and this life-saving legislation is one House vote away from becoming a reality. Therefore, I respectfully request the House pass Senate Bill 886 as passed by the Senate immediately. In terms of electricity, roughly 10,000 homes lack electricity. Red tape is as much to blame as funding. It takes anywhere from 1 to 2 years to get the necessary approvals for infrastructure projects. We urge Congress and federal agencies to review federal laws and regulations that impede and delay infrastructure projects. In terms of broadband, roughly 60% of our residents' population lack broadband access. This is unacceptable when considering the opportunity our citizens and residents are denied in our current economy. The broadband limitations for Navajo residents is due to the current broadband infrastructure. There are approximately 1,000 communication towers on the Navajo Nation that provide capability for broadband and broadcast carriers. By comparison, the state of New Jersey, which is almost 1/3 the size of the Navajo Nation, boasts in excess of 1,300 communication towers. In conclusion, Chairman and members of the committee, the Navajo Nation seeks to strengthen the sacred trust relationship between our two governments. Working together in partnership with you, we can close the digital divide, expand access to water, health, and other needs of the Navajo people. In my written testimony, I discussed the impacts of climate change, the closure of Navajo generating station, and other concerns such as air quality and uranium mine remediation. I hope you are able to review those comments as well. Thank you for the opportunity to testify before you today, and I'm prepared to answer any questions members of the committee may have. And thank you, Chairman and members of the committee.
Well, thank you, President Nez, and thank you for outlining those urgent needs, which is obviously the main focus of our hearing today. Next, we have Chairman Sage, who's chairman of the Southern Ute Indian Tribe. You're recognized for 5 minutes. Chairwoman, we can hear you. Go ahead.
Hear me now? Okay. Good morning, Chairman Pallone, Ranking Member Walden, and members of the committee. I am Christine Sage, Chairman of the Southern Ute Indian Tribe. Thank you for inviting me to testify. It is an honor to speak with you this morning about the effect of the coronavirus on the Southern Ute Indian Tribe and the needs of Indian country. The Southern Ute Indian Tribe story exemplifies the success of the federal policy of self-determination for tribal nations. That policy is 50 years old today. The tribe exercised its self-determination when confronted with the coronavirus pandemic early this year. We acted quickly so we could protect all of our tribal members, in particular, our tribal elders and others who are at risk. Because of our diligence, today the reservation is a relative haven amid rapidly increasing cases of the virus. But the pandemic has highlighted weaknesses in the trust relationship between the tribes and the federal government, and that is what I want to emphasize today. Recent legislation was supposed to benefit tribes during this crisis, but it has failed to consider the unique circumstances of tribal governments. For instance, the PPP did not fully take tribes into consideration. Tribes rely on entities to raise revenue to fund governmental operations. This means that multiple tribal businesses may be operating under a single EIN. The SBA processing protocol denies applications for businesses when a loan has already been approved through the EIN of another business, even if that other business is a completely separate entity. This places tribal businesses at an unfair disadvantage, as they are forced to choose only one of their eligible businesses. There is no reason to allow each location of a restaurant chain to apply for a loan, but not each individual tribal business. We need legislation allowing tribal businesses operating under a single EIN to each be eligible for a loan. The CARES Act allocated $8 billion for tribes. Congress directed that the funds be dispersed within 30 days to address the emergency needs of Indian country, but the full disbursement of those funds was delayed by up to 2 months. Confidential data provided by Treasury by tribes were leaked to the public. The guidance on the use of those funds comes from Treasury, and once again, it is apparent that it does not understand how tribal governments operate. That guidance is often inconsistent, unclear, or inapplicable to tribes. Tribes are not permitted to use the funds to continue to pay employees who are unable to work due to the coronavirus. But states may use those funds to pay those same employees unemployment compensation if the tribes terminate their employment. Additionally, the guidance is so restrictive, it makes it difficult to put the funds to good use without risk of an audit. Moving forward, prior to issuing guidance, Treasury needs to genuinely consult with tribal government. The third area of focus is around the oil, gas, and energy industry, which has been ignored during this economic crisis. It is vital to the economies in much of Indian country. We must use this opportunity to revitalize tribal energy programs and prepare for the future. The Energy Policy Act of 2005 authorized the Department of Energy to establish the Tribal Energy Loan Guarantee Program, which is seriously underfunded. Subsidy funds must be appropriated and used to support the development or expansion of power generation and transmission projects that employ commercially proven carbon neutral and or renewable energy technologies. The current tribal program only provides up to 90% guaranteed for loans, while the innovative energy programs provide 100%. The tribe requests that the percentage guarantee be increased to 100% for innovative technology programs, projects on tribal land to make energy development on tribal land equitable with development on non-tribal land. Seed capital and feasibility study grants would also improve the speed and consistency of developing these projects. Finally, the pandemic has highlighted the weaknesses in communication and high-speed internet technology in Indian country. Many tribes like Southern Ute are in remote areas where the broadband infrastructure is weak or non-existent. Our students are unable to participate in distance learning, and our elders are unable to connect with the healthcare provider virtually. 50 years ago, when the federal government embarked on this era of self-determination, Congress was able to look at the mistakes of the past, learn from them, and assist tribes in a process of achieving self-determination. Today, we likewise can look at the events of the past few months, identify the weaknesses in our federal tribal trust relationship that have been revealed by this crisis, learn from them, and correct them. Thank you for your time. Duwij Doya.
Chairman, you're on mute.
I'm sorry, I keep forgetting that they turn it off automatically. So as I said, I wanted to thank the chairwoman, Sage, who just spoke. And now I want to go to President Sharp. President Sharp is the president of the Quinault tribe, but she's actually testifying today on behalf of the of NCAI. So President Sharp, you're now recognized for 5 minutes.
Good morning, Chairman Pallone and Ranking Member Walden. On behalf of the National Congress of American Indians, I thank you for convening this hearing. My name is Fawn Sharp. I am President of the Quinault Indian Nation and President of the National Congress of American Indians. Like all governments, tribal nations strive to ensure the well-being of our communities through the delivery of essential government services. These services are funded by the trust responsibility of the United States. This obligation has been chronically and for a long time been underfunded, as was documented in the U.S. Commission on Civil Rights report that was recently released to Congress last year. This details and concludes not one federal agency is living up to its trust responsibility on every sector affecting our lives and our communities. There is a widespread and chronic underfunding. These disparities have led to our vulnerability and the disproportionate impacts of COVID-19 to our communities, both in terms of our infection rates and rate of death. To address this pandemic, we urgently need an increase to the tribal set-aside in the Coronavirus Relief Fund. We've heard there's a belief that tribes don't need additional funding, which creates a real problem. Treasury has set a timeline of July 17th to report back the use of the funds. And we are very concerned that this report is going to create a distortion on the need within Indian country, because it's been nearly 3 months since these dollars were appropriated by Congress. And we are just now starting to see the bulk in the remaining balance from the fund. 60% was released. We had to go through litigation. And so we're at the point now where we are among the most vulnerable. We are disproportionately impacted. And it's an outrage that at this point, we still do not have the funding that Congress appropriated 3 months ago. And so I want to make it very clear that there is a need in Indian country, and we do need additional dollars. In addition to the pandemic, we also must respond to some of the structural barriers within Treasury. And I want to focus my testimony today on a few points. I'd like to speak directly to healthcare. With regard to healthcare, we must secure stable funding. We experience the greatest health disparities in the United States, and we are harmed by the delays in federal appropriations because tribal programs are funded by the trust responsibility. Since 1998, only once has the Interior, Environment, and Related Agency appropriations bills been enacted before the new fiscal year. Recently, in 2019, the government shutdown led to the reduction of health services, endangering tribal health. To address this instability, Congress must pass legislation authorizing advance appropriations for both IHS and BIA, which would protect essential tribal government services from appropriation delays. Additionally, stable funding is needed in the special diabetes program for Indians. Presently, we have disproportionately high rates of diabetes, which has increased the lethality of COVID-19 to our population. The special diabetes program has reduced the prevalence of this disease and saved Medicare $52 million per year. Despite this success, it's been flat funded at $150 million since 2004. And short reauthorizations have impaired programs at the expense of patients. To sustain this critical program, Congress must support long-term reauthorization and stable funding. I'd like now to shift to the topics of climate change and clean water. Climate change threatens the health, culture, and economies of tribal peoples. Due to these impacts, tribal nations are key partners in the national and global response to climate change. To support this partnership, Congress should pass legislation that includes full and meaningful consultation with decision makers, co-management opportunities, and financing climate activities, and to ensure that there's government parity in climate action by including tribal nations in federally funded responses to the climate crisis. In addition to climate change, tribal communities experience environmental disparities involving lack of access to clean and safe drinking water. The EPA's Safe and Clean Drinking Water state revolving funds are important mechanisms for addressing these issues. While we appreciate H.R. 2's increases to the revolving funds, a 5% tribal set-aside is needed to address the severe water access needs to tribal communities. We also encourage Congress to increase tribal energy access and development. Tribal nations encounter many barriers in developing energy resources within their homelands, including financing challenges. The Department of Energy's Office of Indian Energy provides funding for developing energy infrastructure on tribal lands. Recently, H.R. 2 increased funding for this office. We appreciate this increase and also request elimination of matching requirements, which are an access barrier for many tribal nations, especially during the pandemic, which has resulted in loss of tribal revenues. Furthermore, removal of statutory programmatic restrictions is needed for other energy financing to enable tribal access. The Department of Energy's Tribal Energy Loan Guarantee Program was authorized in the Energy Policy Act of 2005 and not funded until 2017 and hasn't financed any projects. In part, this is due to the eligibility requirements that require complex commercial financing. Removal of these non-statutory restrictions would allow applicants to access the credit necessary to develop energy resources and sustainable businesses. I finally would like to speak to the issue of telecommunications accessibility. To address immediate connectivity needs, Congress should ensure all tribal nations are eligible for temporary authority to unassigned spectrum on all tribal lands. Congress should also extend the FCC's 2.5 gigahertz tribal priority window, which closes on August 3rd, 2020. A spectrum license enhances broadband and mobile coverage. Emergency access to unassigned spectrum supports immediate broadband deployment, while the TPW aids long-term broadband infrastructure. Presently, tribal nations are responding to the pandemic and would have to divert resources to meet the August deadline. Tribal nations and NCI have requested an extension of the TPW until January 2021 due to the pandemic, and to date, FCC has not responded. Further, FCC has created classes of tribal nation in its spectrum and other proceedings, which is a violation of its trust responsibility and furthers connectivity challenges by providing checkerboard coverage. To address these issues, we urge Congress to extend the TPW deadline and ensure the FCC makes all tribal nations and lands eligible for this opportunity. In conclusion, I thank you for the opportunity to testify, and I look forward to answering any questions. CF Will.
Thank you, President Sharp, and thanks for all that NCAI does on a regular basis to inform us as members of Congress of what needs to be done and what are the priorities for Indian country. We really rely on you. So now I want to turn to Dr. Grimm. You're recognized for 5 minutes.
Thank you, Chairman Plum. Good morning. Ranking Member Walden, members of the committee, we want to let you know that Indian country truly appreciates you holding this important hearing on addressing the urgent needs of our tribal communities. I also want to thank Representative Mullen for that kind introduction. My name is Dr. Charles Grimm, and I'm the Secretary of Health for the Chickasaw Nation. The mission of the Chickasaw Nation is to enhance the overall quality of life for the Chickasaw people. In 1994, we entered into a self-governance compact to become a tribally operated healthcare system. And today, we currently serve over 90,000 patients through a hospital and 3 outpatient facilities with a staff of 1,700. This committee knows that the health care for American Indians and Alaska Natives often comes from a system that's separate from that of mainstream America. The IHS is the federal agency with the primary responsibility in fulfilling the trust obligation. Today, acting under the broad authorization of the Snyder Act, Congress appropriates funds to IHS. However, the amount of those funds are inadequate to fulfill the vast needs. And the cost of care during the COVID-19 pandemic is an added financial burden to an already overwhelmed and underfunded healthcare system. Prior to COVID-19, the Indian health system had an average 25% clinician vacancy rate and a hospital system that remains over 4 times older than the national hospital system. Limited intensive care unit capacity to address a surge of COVID-19 cases has further strained limited purchased and referred care dollars. And while CDC has noted that hand washing is one of the chief preventive measures against COVID-19 infection, approximately 6% of American Indian and Alaska Native households lack access to running water. Before COVID-19, the Indian health system faced significant funding disparities when compared to other federal healthcare programs, but now COVID-19 has greatly impacted the finances of many healthcare programs. Workload comparisons for the Chickasaw Nation show a decrease of approximately 46%, and our third-party revenue has decreased approximately $25 million. While Indian country appreciates all that has been done in the current funding packages for COVID-19 and ensuring that funds have been made available for Indian country, it's imperative that the obligation to fund Indian health care be met in the face of this pandemic. Chickasaw Nation Governor Bill Anatubby declared a state of emergency on March 17, 2020. Within the span of less than 2 weeks, the majority of in-person visits were converted to virtual visits. A daily employee and patient screening process was introduced at all of our facilities. A call center was introduced to triage patients and employees. A COVID-19 clinic was developed to help see persons with symptoms, and testing tents were set up throughout the Chickasaw Nation. To date, we've tested over 25,000 American Indian and Alaska Native patients, as well as non-Native community members and employees. We also stood up our incident command team and integrated with local, state, and national entities, IHS, CDC, FEMA, and DoD emergency operations. Because of the swift action and declaration by Governor Anatubby, close all non-essential businesses and offices in the Chickasaw Nation, we currently have a very low positive prevalence rate with approximately 400 positive cases today. I would ask the committee to consider the following funding priorities which would help Indian country address some of our needs. $9.1 billion in FY 2021 funding for IHS is recommended by the Tribal Budget Formulation Work Group because the lack of a timely enacted budget will leave us all unprepared for another wave of COVID-19 infections. We asked for approximately $2 billion to fully fund the remaining projects on the grandfathered healthcare facility construction priority list. Also, the IHS Joint Venture Construction Program is one of the most successful, expedient, and cost-effective means of providing new and replacement facilities. On May 8th, 2020, the IHS director announced the selection of 5 projects for new or expanded healthcare facilities through that program, and the Chickasaw Nation was one of those selected. However, since that time, the economy has taken a sharp downturn. So we respectfully ask Congress to consider funding the construction of these 5 critical healthcare facilities. We ask you to consider passage of Senate Bill 3937, Special Diabetes Program for Indians Reauthorization Act of 2019, with slight changes to the new delivery of funds language that would ensure tribes and tribal organizations are able to receive awards through their self-determination and self-governance contracts and compacts. We ask for $1 billion for water and sanitation development across IHS and tribal facilities, which is needed to ensure access to safe drinking water and waste systems. The Chickasaw Nation alone has over $70 million in such need. We also ask for $3 billion for health information technology to address disease surveillance and reporting, a transition to a telehealth-based delivery system, and to allow IHS and tribes to convert to a new electronic health record. We ask for a direct set aside of $50 million for new or expanding tribal medical residency programs, which will help tribes meet the challenges of the physician shortages. And we ask for direct grants to tribes to fully fund broadband access construction projects and fixed broadband wireless solutions. Chairman Malone and members of the committee, I appreciate the opportunity to testify on these important matters today. The Chickasaw Nation is committed to ensuring the highest quality of health care for our citizens, and we look forward to working with each of you in these endeavors to do the same for all of Indian country. Thank you.
Thank you, Dr. Grimm, and thank you for those important suggestions. And then our last witness is Ms. Thomas. You're recognized for 5 minutes.
Thank you, Chairman Pallone. Can you hear me?
Yes.
Okay, thank you. Sorry about that. Good morning, Chairman Pallone, Ranking Member Walden, members of the committee. My name is Pilar Thomas. I'm a partner in the law firm of Quarles and Brady, based out of Tucson, Arizona, where I specialize in working with tribes on tribal energy, natural resource, and economic development. Thank you for the opportunity to provide my views on Indian renewable energy and including urgent energy, tribal energy needs in this very important hearing. I'm encouraged that the House and this committee recognize the importance of renewable energy, energy efficiency, and workforce development for Indian tribes, and the role that tribes can play and should play in the nation's clean energy future. As we just heard from President Nez, Chairwoman Sage, and President Sharp, access and funding for affordable and reliable electricity is critical for community, economic, business, and infrastructure development in Indian country. For many tribes, the broken nexus between energy, water, food, and economic development has been laid bare in the midst of this COVID-19 crisis. Legislative and funding priorities for tribal energy development should seek to accomplish several goals, including, but certainly not limited to, mitigating economic harm from COVID-19 by reducing energy costs for tribal communities, jumpstarting economic development through increased capital and investment in tribal utility and energy development efforts, creating jobs supporting tribal energy self-sufficiency, self-determination, and reliability, and recognizing tribal sovereign authorities over energy development on Indian lands. To accomplish these goals, I'd like to highlight a handful of immediate and impactful opportunities for tribes that Congress can support and should incentivize. Tribes can partner with corporations, for example, for renewable energy procurement. This will support commercial scale development on tribal lands, bringing much needed revenue and jobs, and can be leveraged to attract businesses and jobs to locate on tribal lands. Mass deployment of community solar, distributed energy, storage, energy efficiency, and microgrids will lead to energy cost savings, job creation, energy reliability, and resiliency. And tribal energy utility formation gives tribes the ability to control their energy costs, their energy resources, create jobs, and keep revenue within the tribe. Unfortunately, there are still very many major barriers to tribal energy development. Some of these barriers are structural but can be overcome. Others legal and can be overturned, and still others are physical and financial, which, given enough time and money, can be resolved. One such barrier is state regulatory actions that hinder tribal energy development. For the most part, tribal energy development is dependent on state electricity policy and regulatory regimes through the state's jurisdiction over and regulation of utility companies that serve tribal lands. If tribes want to develop and use their own energy resources, they have to comply with state policies and regulations. Tribal energy policy is cabined by state energy policy. Another major barrier is lack of transmission and distribution infrastructure. Grid modernization is expensive, but necessary to improve grid performance, to integrate renewable and distributed energy and storage, and to improve grid resiliency and reliability for tribal communities. Access to the bulk transmission system and wholesale markets through the middle grid and the capital necessary to build it is also necessary for tribes to be able to access wholesale markets for electricity purchases or to sell power into the market. And a third critical barrier is lack of private capital investment. Federal funding is important, but it's simply not enough. There has been little to no private sector investment in tribal renewable energy projects that directly serve tribal communities, and tribes have lagged behind other governments in attracting outside capital through public-private partnerships. While I have more detailed legislative proposals in my written testimony, let me just highlight two examples of potential no-cost solutions. For example, Congress should amend the Federal Power Act and PURPA to treat tribes as states under those two statutes. This would confirm tribal regulatory authority and jurisdiction over retail and distribution utilities serving tribal lands. Plus, it has the benefit of making tribes non-jurisdictional entities under FERC. A second potential no-cost solution, which was raised previously by Chairwoman and President Sharp, is to amend the Tribal Energy Loan Guarantee Program, expanding eligibility in terms of the types of projects that are eligible and the types of tribal entities that are eligible, authorize direct loans and green bond guarantees, and reduce barriers to applying for and qualifying for guarantees and loans. In short, COVID has exposed some of the energy and environmental injustices in Indian country. It has had devastating public health and economic impacts. But there is hope for renewable energy and energy efficiency deployment to lead the way out. There are considerable opportunities tribes can pursue as economic recovery efforts in the short and long term. It requires, though, that major barriers are addressed by federal policy, law, and funding. Thank you again, and I look forward to your questions.
Thank you, Ms. Thomas, and for that information on the electricity grid and renewables. It's very, very important for what our committee is looking into. So now we're going to go, well, that concludes our opening. So we'll now go to member questions, and each member will have 5 minutes to ask questions of our witnesses. And I'll start by recognizing myself. I mean, obviously there's so many things that I'd like to ask, but I'm going to focus on the digital divide for the most part, because it's so stark on tribal lands. I mean, given what's happening with COVID, the lack of reliable high-speed internet means you're left out of healthcare services, education, employment opportunities, civic engagement, and it's just unacceptable in my opinion. So let me start with President Nez. I'm concerned, like you, that the lack of connectivity will put disadvantaged children further behind in their education. In the Moving Forward Act, we allocated $5 billion through the FCC's E-rate program for schools and libraries to provide Wi-Fi hotspots and other connected devices to families that don't have internet access. And it has a specific guarantee of funding for tribal schools and libraries. So let me ask you initially, if that became law, would schools and families in Navajo Nation benefit, if you would?
Yeah.
Thank you, Mr.
Thank you. Yeah, thank you for the question, Chairman and members of the committee. Absolutely. The Navajo students, the Navajo people would benefit on getting high-speed internet access locally. But our goal here on the Navajo Nation is to reach more into the rural areas, into the house. With this COVID-19 right now, Chairman and members of the committee, we are encouraging our Navajo people to shelter in place. We have stay-at-home orders. So if people are staying at home and they don't have internet connectivity, they will have to go to these libraries or chapter houses to get internet access, which may, get them exposed to the virus. So there is so much uncertainty here. We all know there's no vaccine, there's no cure for COVID-19. And so our focus here on the Navajo Nation is try to get high-speed internet into the homes where students could connect to their schools and turn in their homework, also telehealth, as well as, we're in a closure right now. The Navajo Nation government is closed. And so a lot of our employees are working from home, and it all is based on how much monies or how much resources could be allocated to get high-speed internet closer to the home. And lastly, I appreciate what was mentioned by Ms. Thomas. We've been talking about funding, we've been talking about projects, but what we really should be focusing our attention on and to get these projects done quickly is to reevaluate federal laws, policies, and regulations. Those are those no-cost changes that can occur so projects can get done quickly and complete. And with the CARES Act funding, the deadline is December 31st. We didn't get the first allocation of the CARES Act fund. Tribes throughout the country didn't get that until 3 months ago. And then 3 weeks ago, we finally got that 40% of the CARES Act funding. And so I'm asking chairman and members of this committee to lead the charge in putting into legislation an extension of the CARES Act funding for tribes, maybe a full year to December 31st of 2021. And many of you know, lawmakers, that projects don't move as quickly in Indian country, and I think that would give us some time to get these projects underway. Thank you, Chairman and members of the committee.
Thank you. Well, I have a minute left. Let me ask Chairwoman Sage, again, in the Moving Forward Act, we have $80 billion to fund high-speed broadband deployment to underserved areas, preference for tribal lands. Do you think that broadband deployment is contemplated by the Moving Forward Act? Would that help the Ute tribe, and what kind of broadband investment would help if not? But I know I only got about 30 seconds left here, so as quickly as you can.
Okay. Well, yes, the tribe would support that. It's clear that funding is sorely needed for broadband deployment for our communities who need it most. We're glad this issue is receiving attention and legislative effort. For example, Senator Ben Bennett from Colorado recently introducing the Bridge Act, which would include $1 billion for tribes for broadband deployment. Thank you.
Thank you, Chairwoman. So now, is Greg on this, or am I going to go to Fred? Is there a ranking member, Mr.? I'm going to Fred? Okay. I recognize the gentleman from Michigan, Mr. Upton, for 5 minutes.
Well, thank you, Mr. Chairman, and appreciate the hearing. I've got really a couple of questions. I want to congratulate you first, though, on your primary win last night. So I'm glad that you're resting comfortably after your landslide victory. Just like to say, the first is, as we look at the $8 billion that was in the CARES Act, Treasury had 30 days to disperse the money. But because of the delays in getting the money to tribes involving litigation with the Alaskan Native Corporation, we have real issues trying to follow the guidance regulations that were provided by the Treasury. Treasury is now requesting all the recipients of CARES to submit what they've spent the money on so far. I know that it's somewhat unique here in terms of what's happening, but can you expand on how you're all going to comply with that and what we might want to do to try and help? Maybe President Sharp first. And again, I'm watching the clock and I want to make sure I have the questions here again.
Yes, thank you so much. You're right. There was a deadline of April 26th to get this funding out to tribal nations. That was not met. And I would like to just provide a little bit of context to why this is such an urgent need. So tribal nations are limited in taxing authority. So we, instead of being able to generate revenues like any other government through a system of taxation, we're forced to generate profits in commercial enterprises. And so because of the pandemic, our economies have been suffering. So we desperately need the additional dollars in the relief fund. So not only is there a delay in the trust responsibility necessary resources of that relief, we cannot spend money to backfill lost revenues from our economies, from our commercial enterprises. Treasury has explicitly said we cannot use these funds for business losses. In other words, in loss of any sort of revenue through taxation or through business. So that is crippling us. And not only are we vulnerable because we don't have economic relief, any opportunity we have to access resources through the national stockpile and other things are limited. So like Chairman Fraser, we have no choice but to stand at the border to try to protect our tribal nations. We're vulnerable, we don't have resources, we don't have access to PPE, and we are suffering. We desperately need to have increases, and we desperately need to make sure that Treasury appropriates and distributes these dollars the way Congress intended.
Well, thank you. Chairman Sage, you did mention thanks for submitting your testimony in advance. You mentioned in your testimony that the oil and gas industry has been, in your words, ignored during the crisis. What effect has the oil market crash had on your tribe and your ability to invest in the regional economy and workforce? And you mentioned that in the Southwest Colorado, all of your employees, mostly non-tribal members, are receiving full pay. How important is that fossil energy, especially natural gas, to your economy, and what role do you see it playing in the years ahead?
Thank you for that question. The price collapse for oil and gas has caused us real problems. The virus only made them worse. Many of our producers are shutting in, and we are actively seeking relief that our producers don't just give up and leave and abandon active wells. The price collapse for oil and gas has been challenging, and the virus has amplified those challenges. Many of our producers are shutting in, and we are actively seeking relief for producers to continue production through this pandemic, sustaining the local economy and preventing orphaned well bores on the reservation. The tribe has not furloughed or laid off any tribal employees, which has supported the local economy at the expense of risk of the tribal economy. So thank you for that question.
Well, thank you. So since you do have energy in your backyard, how do you strike the right balance between the environment and able to conserve scarce resources like water? Chairman Sage?
What was that again, Mr. Upton?
Since you have energy production right there in Southwest Colorado, how is it that you're able to strike the right balance? As we know, all the Colorado water issues that are there between protecting the environment and scarce resources like water.
Well, with the water and the economy, really we have a lot of our water is irrigation water for our farmers and our ranchers. And this has really put a damper on it because we have our dilapidated irrigation system. And that was brought forth earlier. As of during this pandemic, it's taken a lot of the economy also away from our farmers and ranchers in this day.
Okay. Well, then I know my time has expired. I yield back, Mr. Chairman.
I'm sorry. Next, we have Bobby Rush is recognized for 5 minutes.
I want to thank you, Mr. Chairman, for holding today's important hearing. I also want to thank our witnesses for sharing their insights. The coronavirus pandemic continues to shine a harsh light on the disparities that exist and persist within our nation's most vulnerable communities. These disparities include the long-standing needs of our tribal communities, our tribal nations, among others who have a limited access to physical infrastructure, reliable electricity, and the workforce training need to support these critical resources. Ms. Thomas, you were a senior member of DOE's Indian Energy Policy Office. How are communities best served by this office, and what improvements should be made to the administration of the program?
Thank you very much, Congressman. Yes, I formerly served as both the Deputy Director and Acting Director of the Office of Indian Energy Policy and Programs in the Department of Energy in the second term of the Obama administration. One of the biggest challenges that office had, we stood it up from scratch, basically, and one of the biggest challenges that the office had was a lack of administrative infrastructure. And our primary focus, though, was to put together programs that would directly help tribal governments and tribal enterprises, including tribal leadership and tribal staff, with building capacity to help them understand and develop their energy resources. We had an all of the above energy policy. And so our focus was to use not only the office's resources, which were very limited at the time, $2 million, I think was the budget that we had. $5 million had just been appropriated. Congress has been kind to the office and substantially increased its appropriation. Now I think the House Energy appropriation just increased that to $22 million, and those resources are greatly needed. Those resources tend to be split between technical assistance for tribes and other capacity building efforts and deployment grants for tribes. There is a bit of a challenge now, though, as tribes get more sophisticated and try and do more projects, with the department being able to keep up with them and the resources necessary for the department to keep up with them. So the more funding that Congress can provide to that office to help with technical assistance, to help with capacity building, 575 tribes plus 200 plus Alaska Native corporations and countless other tribal energy enterprises, which are all covered by the office, is a lot of constituency. So I do think that there's a lot of benefit to continuing to fund that office at a robust amount so that it can continue to do some of that soft touch work like technical assistance and capacity building that's necessary to keep moving energy development forward on tribal lands.
I want to thank you, and Mr. Chairman, I see my time is almost expired, so I yield back the balance of my time.
Thank you. Thank you, Mr. Rush. Next, we're going to go to the gentleman from Illinois, Mr. Shimkus, recognized for 5 minutes. I can't hear you, John. Are you on mute? Can the rest of
Sorry. Yeah, I'm sorry. I thought they were unmuting us from your end also. So
That's
let
all
me
right.
let me thank you all. Chairman's great hearing. Actually, it's just it's too much, really. We should have one on health. We should have one on telecommunications. We should have one on energy because there's obviously so much in our jurisdiction. So I'm going to boil it down to 3 quick questions. One's just an observation, Chairman. We have this NDAA bill coming up, which the authorizers are trying to steal our jurisdiction under the Legato FCC ruling. If I've heard anything from the testimony today is that broadband internet access is critical. And if we allow the HAS to interfere with the ability of this satellite broadband, this will not provide our tribal entities an ability to get connected, either their healthcare or their energy or their educational issues. So I would hope that we would develop a bipartisan strategy for the floor to offer an amendment to strip, I think in the HASC bill, 2 amendments were passed by our good friend Mike Turner that will hurt this ability for Legato. And as you know, Legato was passed by the FCC unanimously, which doesn't happen very much. So I put that on the table. I think everybody understands the importance of broadband connectivity. I'd like to go back to Ms. Thomas because also easing regulatory burden on energy resources is something that we've talked about numerous times. And I'm surprised that nations don't have their ability to control their own destiny in energy development. So, of course, in rural America, we have rural electric co-ops that are not-for-profit entities. Are you asking for something like that in that ability to create some energy independence for Indian nations?
So thank you, Congressman. So in about 16 states, rural electric co-ops are not regulated by the state utility commissions. In the rest of the states, they are. So in Arizona, for example, our Arizona Corporation Commission does regulate the rural electric co-ops from a rate-making standpoint, tariffs, reliability. They're subject to the state's renewable energy standard. But in 16 states, the states don't exercise jurisdiction. So the co-ops, like public power companies like LADWP, set their own rates. Of course, they're member-owned and member-driven. So the idea is that the members would help kind of control what the co-op does. There is some friction, admittedly, between tribes who are trying to do, especially distributed energy, rooftop solar, and co-ops who have limits on the amount of renewable energy they can put into the system. It's a complicated backstory, because the G&Ts, the big G&Ts, play a role in that, like Tri-State and Basin. But there is a challenge. There's one tribe, for example, that does have a utility regulatory scheme that it imposes on its co-op. And so if tribes in co-ops that aren't regulated by the state do want to do more renewable energy, do want to interconnect community solar or rooftop solar, going through a state regulatory scheme can be problematic if the state itself doesn't propose that.
That's helpful. Let me get back. Let me just get to President Nez real quick, because reliable, low-cost energy, I'm from Southern Illinois, and it's a coal basin area. President Nez, what happens if and when your coal-fired power plant is goes offline? What happens to the economy? What happens to the employees? What happens to all the folks in that line of work? That's President Nez.
Yeah, sorry, I was on mute. Thank
Oh, that's
you
okay.
for the question, and members of the committee and chairman. We already are going through a closure of a generating station, two actually, one on our lands, the Navajo generating station. The closure of that facility affected the coal mine operation, and that had to close because that's where the coal was going to the coal-fired power plant. Now, between the two there, $30 to $50 million of revenue coming into the Navajo Nation is now gone. And so we have to supplement that. And in order for us to bring in new monies, we're looking at, extending broadband and to have other businesses flourish here on our Navajo Nation to bring in that $30 to $50 million loss. Thank you.
Thank you. Thank you, Mr. Chairman. I yield back.
Thank you, John. Next, we have Ms. Eshu, recognized for 5 minutes.
Thank you, Mr. Chairman. Congratulations on your win last night. And I want to thank all the witnesses. You've given superb testimony. And what I'm so is that in all of the basics of life, whether it's clean water, electricity, connectivity relative to broadband, healthcare. There really is a national shame that surrounds what is taking place, and I think really true neglect for Native Americans. So there has to be the political will to get these things done. These are not issues that we don't know how to address. It's a matter of political will. So thank you for your testimony. And there's, to me, an enormous sadness that surrounds all of this. Let me start by asking Dr. Grimm and Jonathan Nez and Christine Sage, have your tribes been able to get adequate PPE, diagnostic testing supplies, and other resources like ventilators and drugs to treat COVID-19 cases in your communities? One of the challenges is getting adequate supplies, and it seems to me that there's confusion regarding how Indian health programs can access the strategic national stockpile. So have tribes been able to access the strategic national stockpile? Any one of you can address that?
Yeah, thank you. This is Jonathan Nez. Thank you, Representative Eshu. In terms of your question, the Navajo Nation, did get some supplies from the Strategic National Stockpile, but it took some time before that resource came to the nation. And when that also came to the nation, we also noticed that some of the items and those supplies were outdated. But we did have to use what we were given because of the shortage throughout the country, of course. That first spike, there was just so many governments and out there and municipalities wanting to get PPEs. Mm-hmm. And so tribes were left bidding on this finite resource out there. And sometimes tribes, most of the time, maybe all of the time, tribes were on the back burner. And states like New York and other states were getting the most of these supplies. But we are hopeful that the other industries out there will be supplying more PPEs. And maybe it's time for tribes to develop their own stockpile for their nations as well. Thank you, Representative.
That's a good idea. To Ms. Sharp, what clarification do you think is necessary to allow tribes to be able to access the stockpile?
I think there needs to be clarity in direct access. It was very clear to us early in the pandemic that those outside of the United States, the World Health Organization, the IMF, the World Bank, all understand the vulnerability to indigenous populations. And there's been a call out for global action to address the desperate needs among Indigenous communities, because everybody recognizes our vulnerability. And so to the extent there's an economic recovery plan, a global strategy for building economies, I think there's an appetite to work to safeguard our economies. We also saw that the World Health Organization called for private sector partnerships with the UN Foundation and the Swiss Philanthropy Fund. So to the extent this pandemic exceeds the scale of public resources, we know there's a global strategy to prop up national economies. We know there's a global strategy for public-private sector partnerships. So that's what we need. We need resources.
I appreciate your answer. Just very quickly, in the California area of the Indian Health Service, the last IHS hospital closed its doors over 5 decades ago. So my constituents and tribes in my area rely on the California Tribal Health Program, which receives very limited annual funding from IHS. So to Dr. Grimm, how are areas like mine with no IHS hospitals and a reliance on tribal health programs treated differently in funding allocations? How best to address?
One of the things I was going to say, Congresswoman, was that IHS as a whole doesn't have that much in the way of intensive care units. There are a number of areas across the IHS that have 0 hospitals, and those that do have it have relatively small number of ICU beds. Our hospital has 6 beds, 6 ICU beds. They happen to all be full today, and so we are at capacity on ICU. Early on, we tried to get resources such as testing materials, testing machines, other things like that, and a lot of times and ventilators too. Somebody would say yes, and they would turn around and pull it back because it needed to go to a higher priority. And so what those places have to do that don't have those resources, they have to rely on the purchased and referred care dollars. They are absolutely at the mercy of that to send somebody off to a hospital that has that sort of capacity.
Thank you, Mr. Chairman, and I yield back.
Thank you, Anna. Next, we go to Mike Burgess. You're recognized for 5 minutes.
Good morning. Did I successfully unmute?
You did.
All right. I cannot see the clock, Chairman, so I'm going to trust your kind nature to let me know about time. You generally do. Let me just say this is a great hearing. The landscape is broad, and I agree with Mr. Shimkus. There is, well, I hope this isn't just a check the box hearing. I do hope that we can come back in the various subcommittees where the jurisdiction is a little more focused and drill down on some of these issues, because the communities that are served, these issues are clearly so critical, and it is hard to distill it all down with just one single broad panel. And Mr. Chairman, just a point, you were talking at the beginning of this, when was the last time we had a hearing on Indian Health Service? I do recall a subcommittee of health hearing, but it was so long ago that Nathan Deal was the chairman of the subcommittee and Sherrod Brown was the ranking member. So I think that was 2005, 2006. So it's, yeah, we were due. So I'm glad you organized it today. Dr. Grimm, I want to thank you first off for your service, and thank you for providing such clear and coherent testimony. One of the things in preparation for this, reviewing there was a report out by the Office of Inspector General on the Indian Health Service, and the title was "More Monitoring Needed to Ensure Quality Care." And one of their suggestions in there is that the Center for Medicare and Medicaid Services assist the Indian Health Service with more frequent surveys. So can I just ask you, and I apologize for not knowing this, but in a non-IHS hospital, I mean, I know it's voluntary, but hospitals have an agreement with the Joint Commission of Accreditation of Hospitals to be surveyed at least every 3 years. Is there a similar Joint Commission survey that happens in IHS hospitals?
Yes, sir. And the 3 years is the normal standard, surveys. I have often thought, with CMS being a sister agency of the Indian Health Service under the Department of Health and Human Services, if they did work together closer when there were problems like that, I thought it would be a great service. They have worked closely with IHS during this time where some of the hospitals, have had some issues that are being rectified now. Some of them have already been rectified, but yes, I think, more frequent surveys would help. And then the other thing, a lot of the IHS regions put together survey teams. And so they will go out and survey, their own facilities on a much more regular basis than every 3 years.
So, and I was on the board of a hospital, community hospital. I'm a physician as well. It was not a good day when the Center for Medicare and Medicaid Services came in and surveyed your hospital. Generally, there was some sort of problem that had occurred. So it was that was actually not looked upon as a good thing. Now, I suspect that if there was a problem, it needed to be corrected. But you do go through the standard 3-year accreditation with the Joint Commission. And then let me ask you this: I served for probably 20 years on our hospital's credentialing board, and I remember having to query the National Practitioner Data Bank for anyone who applied for hospital privileges. Indian Health Service also has the ability to query the National Practitioner Data Bank.
First, let me say I cringed a little bit when I said CMS should come in more often because I'm a CEO too, and I like it every 3 years. But yes, sir, the IHS has criteria, as do all the tribes, on credentialing and privileging their staff. And one of the requirements is to query the National Practitioner Data Bank.
And it's also a two-way street, so there's reportage back to the National Practitioner Data Bank if a problem is identified with a physician's practice. Is that correct?
Yes, sir, that's true, but there's a process within the agency that you follow to get that done, and it's been a few years since I've been there, but basically it rises up through, the region, from the facility to the region to IHS headquarters, where things are reviewed if there's been a potential violation, or a tort, and then a decision is made whether it was the standard of care was met or the standard of care was not met. So the agency has a process to do that, and tribes do the same as well.
So the quality assurance is very similar to a non-IHS hospital. Do I understand that correctly?
Yes, sir, you do.
So, and then let me ask you this. There's been some success in the VA system with the VA Mission Act, and you described your ICU with 6 beds. And so now if you have a patient who requires ventilatory assistance, do you have the ability, or do you contract with another facility to transfer that patient? How is the care for that patient handled when you're in capacity?
Most of the facilities out there, including ours, have, I'll call them preferred provider networks. They're not always called that, but you establish relationships with entities that you use frequently and trust. You have contracts with them. And so most locations have a primary hospital or 2 or 3 that they refer to whenever they cannot provide that care locally or they're at capacity. There are some places within the Indian Health Service, however, that it's 2 hours or more, to the nearest hospital. And so there are those challenges as well. But yes, most everyone has that. But I mentioned earlier in one of my comments, the purchased and referred care dollars, those are unlimited either. And so if you have to refer too many things out, a lot of tribes will run out of that before the year's out.
Okay,
Dr. Burgess, you're a minute and a half over, so
okay.
you got to move on.
Well, I told you I couldn't see the clock, Chairman.
I stopped.
I was depending upon your kindness.
All right.
I have some additional questions about some energy issues. I'll submit those for the record. Thanks, everyone, for being here this morning.
Thank you, Mike. All right, next is the gentlewoman from Colorado, Ms. DeGette.
Thank you so much, Mr. Chairman. And I want to thank all the witnesses for attending today. I want to give a special welcome to the Honorable Christine Sage from the Southern Ute Indian Tribe down in my home state of Colorado. I've worked a lot with the Southern Utes, and I'm glad to see you today. Hope you're staying cool because we're having a really bad heat wave up here in Denver. I'd like to talk about some of the health issues that are unique to tribal lands. And the first thing I want to talk about is I want to talk about the COVID-19. Mr. Nez, you talked about, you very thankfully gave us an update about what's going on in Navajo lands with COVID. But I think, I'm the co-chair of the Diabetes Caucus in Congress, and I think one of the reasons why your tribal issues and COVID are so extreme is because non-Hispanic adults, in particular Native Americans, are 2.5 times more likely to die from diabetes. And I know that diabetes is a big impact on your community. Yes. And I'm wondering if you can talk about how you think that it's impacted the terrible coronavirus crisis that we've had on Navajo lands and in other tribal areas.
Chairman, members of the committee, and Representative DeGette, thank you for that question, ma'am. We have heard the vulnerable population and the elders. The data that I cited earlier in the testimony is that of those 300 plus deaths here on the Navajo Nation, 379 deaths, 66% of those who have passed from COVID-19 are over 60 years old. And those are our elderlies. And our elderlies are in that vulnerable population because, their immune system is not strong, but many of them are, as you were saying, have diabetes, cardiovascular disease, and cancers. And 1 out of 5 of Native Americans do have diabetes. And we here on Navajo are starting to focus more on, our health and well-being, meaning that we should be bringing some of those individuals out of that vulnerable population category so that they have strong immune systems. Yeah. I talked earlier about, being in a food desert. We need to get more foods, healthier foods to our Native American citizens so that their bodies can fight off any virus. So thank you for that question.
And that leads me, that's 20% type 2 diabetes rate among Native Americans. It's stunning. And Ms. Sharp, you talked about, this leads me to my question about the special diabetes program, which was enacted in 1997. Half the money goes for type 2 diabetes among tribes. And it's been reauthorized, but what happens is it's been reauthorized for very short periods of time. And you talked a little bit about this, Ms. Sharp, in your testimony when you said we need to authorize it for a long period of time. Can you talk about why that is so important?
Yes, we absolutely need predictability and a stable funding source to make sure that we can develop not only short-term immediate strategies, but there are these underlying challenges that we need a long-term strategy, and to effectively work with our community to develop a community buy-in and various strategies, we have to have stable funding. So thank you for that question.
Yeah, originally when we first passed it in 1997, we had a long-term authorization, and everybody agrees that it needs to be authorized long-term. It just doesn't seem to happen. I'm going to give a shout out to my colleague, Representative O'Halloran, who's lead sponsor on the 5-year reauthorization, and it calls for $200 million. And frankly, that's really what we need to have. So I'm hoping, and half of the money goes for type 1 diabetes, the other half for type 2 among tribes. And we need to reauthorize both of those components we need to meld them together and do it for 5 years. So, Mr. Chairman, I hope that you can, I know you're committed to doing that too. We just need to make it happen. And with that, I will yield back.
Thank you, Diana. Next, we're going to go to Mr. Latta is recognized for 5 minutes.
Well, thanks, Mr. Chairman, for holding this very important hearing today. Greatly appreciate all of our witnesses for their testimony today and for all that you're doing. President Nez, if I may start with you. In May, President Trump issued an executive order directing federal agencies to review the regulations and modify, exempt, or rescind them in order to help in the economic recovery from COVID-19. On behalf of the Navajo Nation, you submitted a white paper in response to that executive order, outlining some of the regulatory reforms you'd speed up infrastructure deployment on the Navajo land. You wrote that currently federal laws, policies, regulations stifle the completion of projects that address the critical and basic needs of your people. Some of these projects are more than 3 years old because of these obstructions. The Energy and Commerce Committee Republicans recently unveiled a package of 26 bills and for legislation that would achieve many of the similar suggestions you made in your white paper, such as streamlining reviews under the National Environmental Policy Act and applications for co-allocations and exclude previously disturbed land from undergoing lengthy federal reviews. These are rural reforms that don't cost any money that can help bring broadband to unserved Americans. President Nez, what are some of the regulatory obstacles you face in the Navajo Nation to deploy broadband infrastructure?
Wow. Representative Lotta, Chairman, members of the committee, great question, and thank you for reading that white paper. You know, we're in an emergency operation here on the Navajo Nation, all across the country with this pandemic. And so the CARES Act funding was intended to aid and give relief to U.S. citizens. And as we have been mentioning, you know, we got those dollars late into this year. 3 months ago, 40% of the CARES Act that was going to tribes went to the tribes. Just 3 weeks ago, the remaining 40% came to the tribes. And so we have a deadline to get these projects done by December 31st and a little bit beyond that. And so what we need here, and I'm hoping all the committee members recognize that tribal lands are characterized as any federal lands throughout the country. So that you have to jump those through those federal regulations, those policies, and this white paper that we submitted would help temporarily, based on these dollars, get these projects developed in a timely manner. And that's why we're asking for an extension, 1 to 2 years, 2 years at the most extension to get these CARES Act funds, because in tribal communities, it's hard to get projects complete. And one of those examples is right-of-ways, and also, you know, environmental clearances for like 401 and 404 permits. And you also have business site leasing regulations that hinder development. And so if we can, you know, set aside certain policies and regulations to help build a wall between Mexico and U.S., I'm sure we can do the same here in tribal communities throughout the country. And I appreciate that question, Representative Lotta. And I know that this committee could be the champion to, you know, make those changes, not just temporary, but permanently for tribes throughout the country. Thank you.
Oh, thank you very much. Chairman Sage, if I could ask in my last minute and 10 seconds here, Southern Ute Indian Tribe has made significant progress in connecting its citizens despite the challenging geography. How were you able to overcome some of the regulatory barriers that you faced, and how were you able to bring the connectivity to your reservation?
Thank you, Representative Lotta, for the question. The Southern Ute Indian Tribe is unique in many ways, including its success in energy development on the reservation, as well as its robust environmental program. The tribe's sovereignty over its lands enables greater economic development. By making the most of what we've been given by our Creator, we have been able to provide for our people in a meaningful way. Our most vulnerable, valuable resource is our people, but there is still much to be done if we are to reach our full potential. The current pandemic has made some of these hardships very apparent. Historically, tribal lands, particularly those in rural communities, have been the most underserved when it comes to essential communication infrastructure. We are the largest employer in Southwest Colorado and the second largest in the Four Corners area. We have invested millions of the tribe's own funds in technology, but with employees and tribal members working from home, schools, relying on remote education, and health providers relying on telehealth, those investments are strained and our infrastructure has proven inadequate given the demands of the modern era. Most communities across the country are concerned about the speed of their internet and cell phone coverage. For the vast majority of our reservations, we are worried about whether we would support any congressional measures that help enable Indian country to have robust systems. That would include measures to help ease the burden of regulatory constraints on our development. If that funds provided to the tribe have fewer restrictions on their use, a longer time frame to be, we could significantly improve the quality and range of communication services. But as it currently stands, we will struggle to productive use without necessary audit by the Treasury. Thank you very much.
Well, thank you very much, Mr. Chairman. My time's expired and I yield back. And thanks again for our witnesses for being with us today.
Thank you, Bob. Next, we have Ms. Schakowsky. Jan? I think you have to unmute.
I'm doing it. There I am. Okay.
Good.
Thank you, Mr. Chairman. It's just a fact that the United States has failed to meet its responsibilities to provide comprehensive, high-quality health care to all federally recognized tribes and their members. But nowhere is that failure more apparent, in my opinion, than in reproductive health care. Since 1976, the Hyde Amendment has denied federally funded abortion care to low-income, vulnerable women who get their health insurance through Medicaid. But over the past 44 years, the Hyde Amendment has expanded and expanded, and today, restrictions on abortion coverage also impact anyone receiving health care through the Indian Health Service. Because IHS facilities are often the lone source of reproductive health care for Native American women, the Hyde Amendment effectively denies women their constitutionally protected right to a safe and legal medical procedure. A study published by the Native American Women's Health Education Resource Center found that only 25 abortions were performed through the IHS system between 1976, when the Hyde Amendment was passed, and 2002. Tragically, we have also seen nationwide that as abortion access goes down, maternal mortality and morbidity goes up. The Center for Disease Control and Prevention, CDC, reports that today, American Indians and Alaska Native women are twice to 3 times more likely to die from pregnancy-related causes than white women. So, President Sharp, I'm committed to passing finally what we call the Each Woman Act that I introduced with Representative Barbara Lee to end the Hyde Amendment once and for all. But what else do you think we need to do to improve reproductive health care in tribal communities?
I really appreciate that question. Thank you. And thank you for recognizing the disproportionate and high rate of maternal mortality rates. You're right, we do suffer at a rate of 2.3 times higher, and it's even worse in rural communities where that rate is 4.5 times higher for our population. And I can speak from personal experience. I have one child, and I ended up in the intensive care unit. My child was at risk of dying, and he was born at 4 pounds. And I only have one child for that reason. And so, because we do suffer these impacts, it is so very important that we pay special attention to women's reproductive health in appropriations for IHS. So, thank you so much for that question and raising attention to this very important issue.
Well, thank you. And I look forward going ahead to work with you on specifically targeting that community. And let me just say, this is really a historic hearing. We have over the history of our country so badly treated Native Americans, and we're still seeing residuals of all of that. We have to do so much more. But the good news is that we are expanding the number of Native Americans in the Congress. 2 women now, Deb Haaland and Sharice David are in the Congress now. And you know the saying, if you're not at the table, you're probably on the menu. And so we're happy to have them, and now to have this historic hearing. I think we were talking before this, that this may be the first real comprehensive hearing that we have had about tribal communities. And so I hope it's the first of many, and let's work together on women's reproductive health. And with that, I yield back. Thank you so much.
Thank you, Jan. And now we go to Ms. Rogers for 5 minutes.
Good morning. Good morning, Mr. Chairman, and thank you everyone on the panel for joining us today on this important topic. I have the honor of representing several sovereign nation tribes in Eastern Washington, including the Colville, the Kalispel, and the Spokane. Like many other tribal communities in the country, they've been hit hard, especially during this public health crisis, the coronavirus, and the many issues that have been brought to the forefront. The digital divide is especially highlighted in rural communities and in tribal communities, and it's underscored the importance of us taking action to address and close the digital divide. I am proud that the Eastern Washington tribes are working collaboratively with other stakeholders. We have a broadband action team that is focused on identifying and addressing barriers to deployment, including some unique models to lay dark fiber and partner with the private sector to provide the service. Healthcare is also really important, and we must address some of the disparities that are in healthcare. The Colville Confederated Tribe has shared with me that they have seen an abrupt decline in third-party billing during the pandemic that has threatened its ability to finance and construct a new clinic in Omak, Washington. This is one of 5 projects that was selected by Indian Health Services for the Joint Venture Facility Construction Program. It's a very competitive nationwide program, and 5 projects withstood multiple levels of review. However, as Dr. Grimm discussed in his testimony, the viability of some of these projects has been negatively impacted by COVID-19. So Dr. Grimm, I wanted to start with asking you that if Congress makes additional appropriations available for IHS facility construction, should it also allow tribes to use those funds for their approved joint venture projects?
Thank you for that question. I don't say this lightly because that's not the way this program normally works, but I think everyone would agree that we're in unprecedented times. All of those projects went through extensive review, as you pointed out. a competitive process that meant that they were fully ready to do all these things. And now the economy's taken a huge downturn. Tribes have been impacted, as you've heard throughout this hearing. And I think allowing the agency that flexibility or asking them to spend some portion of those funds on these projects is entirely appropriate under these circumstances.
Thank you. I appreciate that, Dr. Graham. And I would like to ask unanimous consent to enter into the record a statement from the Colville, Confederated Tribes of the Colville Reservation, and it's on their joint venture project and the OMAC clinic.
Without objection, so ordered.
Thank you. I also wanted to focus on Medicaid, which is an essential program, and Medicaid expansion has played a critical role for tribal health. However, we know that problems still exist within the Indian health system in states that have expanded, and Washington State's one of those states that has expanded. As we think about how we can support the tribes in both expansion and non-expansion states, we need to have a full understanding of the needs that the tribes are facing and the role here in Congress that we can be playing to uphold our obligations. Dr. Graham, can you just detail some of the issues that we're seeing in the Medicaid expansion states as it relates to Indian health services?
Well, as you pointed out, Congresswoman, those states that have it are doing better than those states that don't. And some studies are coming out now that show it has improved the health care of the population, but it's not the see-all and end-all. And whenever you expand it that broadly, you start running into more problems. And so there's a group under CMS called the TTAG, Tribal Technical Advisory Group. That group debates and talks and discusses all of these issues with CMS. My written testimony, a number of things that would both help the efficiency of the agency and of tribes, but also the funding. I'll give one example of one of the issues. It's called the four walls issue. Part of the law that says that it has to be done within the four walls of a facility. That means at a time like this with COVID, when tribes were putting tent testing centers outdoors, or they might be using alternate care facilities, those things weren't able to be billed adequately. The telemedicine that immediately went into effect across the nation, the billings and the rules around the billing of that has lagged behind. Tribes face another issue around Indian health care providers providing services that are authorized by law, but since Medicaid is a state-by-state program, they don't get to necessarily bill for all those services. And tribes often wish that Congress would fix that issue so that if it was authorized by Indian Health Improvement Act, that Medicaid would allow those services to be billed across Indian country. And those are a few brief examples. I'll stop there.
Great. Well, that was what I was hoping you would highlight, and I appreciate that. Certainly an issue that the committee needs to look at. And I yield back, Mr. Chairman.
Thank you, Kathy. Next is Mr. Butterfield, recognized for 5 minutes. Is GK available? I don't know. He may not be connected because I think he was driving maybe. Jeff, I'm going to move on unless you know that GK is on. Okay, then we go to Ms. Matsui. Is Doris available? Can you guys hear me?
Yes, we can hear you, Chairman.
All right, let me see who's next here, if those two are not here. Oh, okay, so the next one then we'll go to Kathy Castor. The gentlewoman from Florida is recognized.
Terrific. Hi, everybody. Thanks to our terrific witnesses, but Thank you, Chairman Pallone, for calling this very important hearing, and congratulations on your big win last night. I think it's very clear. We didn't even need to have a hearing to understand that our indigenous people and our tribal nations have not been respected under the law. But I'd like to shift to talking about the potential to equalize that through clean energy and climate solutions. Many of you know that last week, the Democrats on the Select Committee on the Climate Crisis, of which I chair, released a majority staff report, which laid out a climate crisis action plan that included numerous recommendations to support tribal nations. The plan calls on Congress to work with tribal leaders to expand clean energy solutions, cut pollution, to advance environmental justice, to improve public health, among other recommendations. We know that tribal nations can contribute to the deployment of climate solutions and clean energy using their natural resources and their longstanding tenets of environmental stewardship. As President Sharp can attest, the National Congress of American Indians has outlined Indian country's priorities for addressing the climate crisis in a resolution that emphasizes the importance of economic development and tribal sovereignty as part of the transition to a clean energy economy. The offices within the Department of Interior and the Department of Energy have provided technical assistance to tribes on clean energy, but the level of support for these initiatives is often inconsistent. Broader infrastructure backlogs at the Bureau of Indian Affairs also need attention and funding. So in addition to major statutes like the Federal Power Act, Public Utility Regulatory Policies Act, Rural Electrification Act, they're all silent on jurisdiction of tribes over utilities. We've discussed some of that today. In a 2015 resolution, NCAI called on Congress to clarify that Indian tribes have regulatory jurisdiction over utilities on reservations or villages. So I'd like to delve into that a little bit deeper and hear from our leaders today. So President Sharp, it's good to see you again. Thank you for testifying and advising the Climate Crisis Select Committee. Thank you for your kind words on our action plan released last week. We recommend expanding and increasing funding for the Office of Indian Energy Policy and Programs at Department of Energy. How would this investment assist tribal communities to advance clean energy infrastructure and other climate solutions?
Yes, thank you so much for your leadership, and thank you for directly engaging tribal nations up to this point. I would really like to focus my remarks around the sovereignty of tribal nations and advancing economies. And as we pointed out in our meeting, and I cited an example, when there was a cap and trade system early in my presidency, the international rate was $5 to $8 a metric ton. Here in this country, it wasn't even close to that level. But domestic companies couldn't access those international markets because the U.S. was not a signatory to the Kyoto Protocol. However, a tribal nation could access those. And so I think looking at global solutions and a global economy, ways that tribes can stand on our sovereign authority, we can attract foreign investment that otherwise we'd never see the United States. So there are many opportunities in partnership that we can do with additional funding and support. So those are the exciting things that we're looking at in building a new economy.
And you all have suggested that on the resiliency piece, there are so many natural solutions for sequestering carbon and putting people to work. And our new the report from the majority staff really suggests bold investments there. Give us some examples of how we can rebuild better at a time when we have over 40 million Americans out of work. And I know that's a deep problem on our reservations and among tribal communities.
The most effective policy that any government can adopt in addressing climate change is pricing carbon. And that means holding those who are directly responsible accountable to generate revenue. Those dollars can be invested in recovery and restoration efforts like salmon recovery. That'll put millions of people back to work with a new economy around natural resources, around restoration. And so we are stand with you to boldly take action to generate revenues that can then be in turn reinvested in creating jobs across many sectors.
Thank you very much. I yield back.
Thank you, Kathy. Next, we go to Mr. Guthrie for 5 minutes.
Thank you, Mr. Chairman. I appreciate the opportunity. Appreciate all the witnesses for being here today. And I just want to start out with the last Congress. I know Representatives Mullen and Ruiz co-chaired a bipartisan Indian Health Service Task Force for the committee. The task force identified numerous issues that should be examined by the Subcommittee on Oversight and Investigations, including issues relating to hiring, treatment of patients, and general oversight. And the agency is in dire need of oversight. And now during the COVID-19 pandemic, we're seeing even more issues within the Indian Health Service that Congress and the committee must examine in more detail. And I really appreciate the hearing today, but I hope that we won't let our discussion end on the issues of today, and that the Oversight and Investigation Subcommittee will hold hearings on oversight of Indian Health Services again this year. So for my first question, Dr. Grimm, the Indian Healthcare Improvement Act authorized billing for different medical services from dental care to long-term care to mental and behavioral health care. These are known as qualified Indian provider services, but because Medicaid is jointly administered by states and the federal government, tribes can't bill for these essential services if they aren't covered in the state Medicaid plan, despite being authorized under federal law. So my two questions for that is, what must Congress do to address this technical issue? And how long would fixing it improve care for Native people? And how would fixing this issue impact third-party reimbursement at IHS, tribal and urban Indian facilities? Thank you.
Thank you, Congressman Guthrie, for that question. That is an issue. The Indian Healthcare Improvement Act allows Indian healthcare providers to provide a number of services. And we're going to do that whether a patient has a third party of any sort or not. But we've come to rely heavily on third-party resources within the Indian Health Service and tribes for our operational budgets. What we need is an authorization from Congress to allow Indian healthcare providers to receive Medicaid reimbursement for all medical services that are authorized under the Indian Healthcare Improvement Act. And those are called qualified Indian provider services. Whenever we deliver them to Medicaid-eligible American Indians or Alaska Natives. Currently, as you pointed out, we only receive reimbursement if a state has made those services eligible. And as you know, Medicaid, varies from state to state in both eligibility and services. And also, you all know that the states don't have to pay any match like they do for the rest of their population for American Indian patients seen in Indian facilities. So what we're asking you to do would not have an impact on the state's budgets either. So thank you.
Thank you for that answer. And then Chairman Sage, in your testimony, you mentioned the impacts that the coronavirus has had on the Southern Ute Indian tribe. Specifically, you mentioned that the pandemic has underscored the lack of access to high-speed internet in Indian country. In my district, the shift to remote learning and working has highlighted the challenge of broadband access, particularly in the rural parts of my district. How is your tribe bridging the gap in the short term? And what are some of the solutions you are looking at to help address this issue in the long term? Thank you.
Well, thank you for the question. Dealing with the gap here with the internet service. We do have our own entity that I oversee with the what is called a SUS department, and they monitor all of the internet, the Wi-Fi that's all available for us. So we get that going. We are successing well with this, but we do need the broadband. My concern with the broadband is that if our students are going to go to college and they're going to have to be taking classes online, there's no way that they're going to be able to do this because they don't have the internet, the service that they will need to exceed themselves. So, and then our telehealth, we have IHS that assists us with this also, but they also say go through the state. You know, we're always, it's just always that we're pushed aside. Nothing's really, you know, dominant and you know, just in stone saying that they're going to assist us here. But we're doing well here with what we have. Thank you.
Thank you very much for your answer. Good timing. I have 5 seconds left, and I'll yield those back, Mr. Chair. Thank you very much for being here today. Thank you.
Thank you, Brett. Next, we're going to go to Mr. McNerney for 5 minutes.
Well, thank you, Mr. Chairman. I think the witnesses, this is a tremendous hearing with a lot of information, could be done in several hearings like Mr. Shimkus noted. But access to broadband infrastructure and electrification are clearly major concerns for the tribal communities. But even where broadband has been deployed, people are still being left behind because they can't afford broadband or they lack digital literacy skills. Now, I'm the House sponsor of the Digital Equity Act, which would help address these challenges. And I've introduced the bill with my colleagues, Representative Clark and Representative Lujan. And I'm very pleased that the NCAI has endorsed it and the House passed it as a part of HR 2 last week. President Sharp, would your communities benefit from resources that would be made available, would make broadband more affordable, equip individuals with devices, and provide literary skills, digital literary skills, and including doing tasks like applying for jobs online? Would that be very helpful?
Yes, that would be incredibly helpful. And we do thank you for your leadership in recognizing the tremendous need and meeting that need with resources. We would also recommend that there be coordination and communication among the various federal agencies because there are a wide range of agencies that are funded, but there's no one lead agency to provide a very clear strategy. So those two things would be very helpful, and we thank you for your leadership.
Well, thank you. That's a good help and information. President Nez, access to spectrum is also important for connectivity needs of the tribal communities. The tribal priority window for 2.5 gigahertz band closes on August 3rd. However, the House acted in HR 2 to extend this period by 180 days. Though the FCC could act on its own to do this today if it wanted to do so. President Nez, applying for FCC spectrum licenses can be complicated, especially for tribal government representing a vast territory. Can you describe the typical decision-making process for the Navajo Nation when deciding whether to apply for spectrum licenses, including how long each step takes?
Yes, thank you for the question, Representative McNerney, and Chairman and members of the committee. Thank you for that question. Navajo Nation is 27,000 square miles. We are in 3 states. You know, there was mention of Medicaid expansion. We got to deal with 3 states. And in terms of broadband and internet access, telecommunication, we have to be able to work with the states as well. But this initiative, and I appreciate you championing this for tribal communities, will allow tribes to fit in the 2.5, at least Navajo Nation, let me say that, Navajo Nation 2.5, to be able to be used in the ruralmost parts of the Navajo Nation, and that is in the eastern part of the Navajo Nation. And one example, in the western part of the Navajo Nation, we have a hospital there that doesn't have internet capability for really connecting to the word came, I forgot what it's called, the connectivity there that we utilize for funding during the American Recovery and Reinvestment Act, the fiber, there it is, fiber line to go to the hospital. And right now that hospital in that community that doesn't get that fast speed internet. So during a COVID-19, this pandemic, it's going to be hard for telemedicine and also getting, and this type of spectrum would help get some relief getting high-speed internet and connectivity to these places that don't have fiber. Thank you, Representative McNerney.
Well, what else do you believe the Federal Communication Commission should be doing to help on this issue?
Well, the FCC, if they would look at some of the white paper, Representative McNerney, about how we can have federal agencies work together to, either set aside, I hate to say waive, but to set aside these federal regulations and policies so that we can get high-speed internet and also cell service for those people that don't have it, especially now. We have to have students go to these hotspots in order for them to get internet availability. And here we're in a shelter in place or a stay-at-home order, and we're seeing students traveling to these hotspots and even community members going to these hotspots. Whereas if we open it up, they could be able to connect from the home, which would lessen this, the spread of coronavirus here on the Navajo Nation. Thank you.
Thank you. My time has expired, but I'm going to submit a question for the record about the uranium tiling's effect on the Navajo Nation. Thank you. I yield back.
Thank you, Jerry. Next, we have Mr. Griffith.
Thank you very much. Can you hear me, Mr. Chairman?
Yes.
Okay, excellent. Chairman Sage, it is remarkable what the Southern Ute has accomplished over the last several decades, creating and operating new businesses on and off the reservation that now generate millions annually for your tribe. While your tribe seems to have a very diverse portfolio of investments in real estate, housing, and gaming, oil and gas production appear to be particularly important. Can you share a bit about your tribe's experience with the National Environmental Policy Act, also known as NEPA, and on any other federal regulatory barriers as you have advanced energy development on your tribal lands?
If I can get this to mute.
Yes, ma'am.
Thank you for the question. Yes, NEPA hinders on reservation development and construction, not just energy development. Every time a major federal action is pending, NEPA is triggered. At a minimum, agencies should use tribal environment analysis, and where the tribe has the kind of sophisticated government, such as Southern Ute Indian Tribe, it should be allowed to develop and administer its own TEPA, Tribal Environmental Policy Act, instead of the federal NEPA. With the Part 2, the tribe often faces inconsistent requirements through the various federal agencies on a single project. BLM, BIA, and USFS, United States Forest Service, have inconsistent requirements. Consistency across federal partners would greatly benefit Indian country. Thank you.
And so would you support current efforts to modernize NEPA to help bring clarity to these various matters?
Yes, definitely.
And are you concerned by some of the environmental proposals, particularly those that are more extreme, that are out there that would ban fracking or phase out fossil fuels completely?
That's a good question. So,
to be determined.
Yes, definitely. It would have to take a lot of review, collaboration to make sure that this is going to benefit the Southern Ute Indian Tribe.
Right. And of course, if you ban fossil fuels outright, then you have the same situation that President Nez had, where they're looking at, as many people in my district are looking for ways to replace the revenues from coal. And his statement early on said $30 to $50 million had been lost by the nation as a result of closing down the coal-fired power plant and the coal mine that previously was hiring and employing members of his nation. Would that be the same if they suddenly shut down oil and gas production in your area?
Yes, it's a balance there. So it would definitely be some type of a balance. But
And I appreciate that.
it will affect us, so definitely. Thank you.
And President Nez, do you have any comments that you might make on how do we replace that $30 to $50 million that you said was lost as a result of the shutting down of the coal-fired power plant and the coal mining jobs? How do we replace that? And how does that impact your ability to try to get electricity to the roughly 10,000 homes in the Navajo Nation that currently lack electricity?
Yeah, well, thank you for that question, Representative Griffith. And let me go to Representative Castor's question about clean energy and climate change. Yes, we are seeing closures of coal-fired power plants, one on the Navajo Nation, another outside our nation, and there's a potential of others closing down in the future. And that's jobs and revenue and the local economy getting impacted negatively. But there is a move to transition away from fossil fuel into renewable energy. We do have some projects that are being planned right now, solar and wind. And, you know, it comes back to, as was mentioned, these federal regulations, you know, NEPA, to be able to set some of those regulations aside could really jumpstart some of these projects quickly. And I appreciate you all talking about that. Thank you.
So reforming NEPA would actually help some of the renewables as well. One of the other things that I've been championing is that we have research parity on both fossil fuels and clean energy fuels. I'm not trying to reduce any of that, but I think if we had parity, we could maybe figure out a way to make that coal-fired plant a little cheaper or a little more efficient and less costly in the sense of pollutants. That being said, I see my time is up and I have to yield back, but thank you so much, all the witnesses, for your time.
Thank you, Morgan. So next we're going to go to Mr. Lujan.
Thank you, Mr. Chairman. I appreciate that very much. It's an honor to be with you. To every one of the panelists, it's an honor to be with you as well. Thank you for being available today. And a special greetings, Mr. President, to President Nez, Yat A. Shakis. Hello, my friend from the Navajo Nation, which I'm proud to represent in New Mexico. The 3rd Congressional District of New Mexico, I'm proud to represent 15 Pueblos, the Jicarilla Apache Nation, and the Navajo Nation. And the conversations with tribal leaders and Pueblo leaders have made clear that the coronavirus pandemic has exacerbated challenges and inequities that long existed before COVID-19. The inequities include a lack of access to broadband, insufficient housing support, barriers to ensuring an accurate census count, and a failure to guarantee access to the ballot box. Simply put, the federal government is not living up to its trust responsibilities. Housing, water, healthcare, road, and broadband projects are underfunded and often wait for federal approval while communities suffer. These failures span many decades and presidential administrations, and it's not acceptable. And as a Congress, we must come together in a bipartisan way to fulfill our obligations to tribal communities. Dr. Grimm, your testimony is very clear on this. Will you please state yes or no whether the Indian Health Services has chronically been underfunded before COVID-19?
Yes, sir, it has.
And I've spoken about a $3 million IHS contract awarded to a former Trump White House staffer whose company delivered thousands of faulty masks that were unfit for use, which IHS fortunately discovered before they were distributed to the facilities in my state. Dr. Grimm, yes or no, is it acceptable that IHS patients and physicians and first responders should receive lower quality supplies, lower quality facilities, or lower quality healthcare?
No, sir. None of those things are acceptable.
I appreciate that, sir. President Nez, in your testimony, you note that the digital divide impacts businesses' ability to thrive, students' ability to learn, workers' ability to telework, and patients' ability to see their doctor. And all of this has been made worse by the COVID-19 crisis. According to the FCC, more than 60% of New Mexicans living on tribal and Pueblo lands lack access to high-speed fixed broadband. This is unacceptable. President Nez, yes or no, do we in the Congress and the federal government need to make more robust investments in broadband access to ensure that tribal communities are not left behind?
Absolutely. Yes, and oh, my friend.
I appreciate that, Mr. President. Recently, FCC Commissioner Rosenworcel joined me in New Mexico to have a conversation with tribal and public communities about the E-rate program, which is an important program to expand broadband connectivity to educational facilities, to libraries. President Nez, to meet long-term needs once the stay-at-home order is lifted, yes or no, do you agree that Congress should support connectivity at tribal anchor institutions such as tribal libraries, schools, and chapter houses by making them all eligible for the E-rate program?
Yes. Oh.
And President Nez, in your testimony, you say that the United States must, quote, address all the health, cultural, and environmental consequences of uranium extraction and processing on Navajo lands. As you know, these consequences include severe forms of cancer, kidney diseases, and respiratory illnesses. Yes or no, has the COVID-19 crisis exacerbated the health impact of our nation's legacy of uranium mining on the Navajo people?
Yes, absolutely. Oh, hey.
Mr. President, yes or no, should Congress pass the Radiation Exposure Compensation Act amendments to extend RECA and expand compensation to all those impacted by uranium mining and nuclear testing during the Cold War?
Yes, sir.
I appreciate that, Mr. President. And that's one area where I'm hoping my colleagues, Democrats and Republicans who are currently not co-sponsors of providing support to uranium mine workers and communities like in New Mexico, where the first bomb was tested on soil, we're not included in downwind communities. I hope we can all come together and pass this legislation. And as you heard from President Nez, it's important that aspects of the RECA be included in whatever the next funding package is in response to COVID-19, because of the exposure to so many families because of the respiratory illnesses. And then the last question I have, Dr. Grimm, what does the lack of access to running water mean for tribal communities and public communities, including families, risk for COVID-19 and other health issues?
Well, as you know, Representative Lujan, American Indian and Alaska Natives, their homes have less 6% that have unacceptable water and sewer compared to 0.5% for the U.S. white population. What it means specifically in COVID-19 is that one of the biggest things CDC says to do is wash your hands. They don't have the ability to do that. If you look at the mortality and morbidity statistics within the Indian Health Service and you take a look at how much can be reduced by safe water and safe sewer, no matter whether you go to an IHS or tribal hospital or clinic, it's remarkable. It's absolutely necessary for people's health, and it's absolutely necessary during COVID-19.
I appreciate this. And I yield back, Mr. Chairman. I think Dr. Grimm's testimony said that it was 10.83% times more likely in homes without indoor plumbing that there would be spread of COVID-19. Thank you for this important hearing, Mr. Chairman. I yield back.
Thank you, Ben Ray. Now we're going to move to Mr. Bilirakis. You're recognized for 5 minutes.
Thank you. Thank you, Mr. Chairman. I appreciate it very much. I want to thank the witnesses for testifying today as well. Dr. Grimm, clinical trials often provide patients with the best, perhaps only treatment option for their condition. However, without coverage or routine costs associated with participation in clinical trials, many Medicaid beneficiaries do not have the latest technological and scientific advancements as a treatment option. Medicaid serves many demographics, including tribal communities, that are underrepresented in current clinical trial enrollment. Lack of participation in clinical trials from the Medicaid population means these patients are being excluded from potentially life-saving trials and are not reflecting the outcome of the clinical research. Congressman Lujan, my good friend, and I introduced H.R. 913, the Clinical Treatment Act, which would address this issue by providing coverage of routine care costs associated with clinical trial participation for Medicaid enrollees. And this is a question: does increased access to clinical trial participation for Medicaid enrollees help ensure medical research results more accurately capture and reflect the population of this country? And if so, why is that important? And especially if we develop better treatment options and a vaccine for the COVID-19. That's a question for Dr. Grimm, please.
Thank you, Congressman. You're absolutely right that there's been underrepresentation in a lot of clinical trials of all minority populations and Medicaid eligible patients. One of the reasons that it's so important is that if a new drug or a new treatment is not tested on a specific population group, whenever that medication or treatment comes out, doctors ask themselves, especially doctors in Indian Health Service, they'll say, there really wasn't a significant or any, Indian population in this particular trial. How do we know this drug is going to work the same on our population? And that goes across the spectrum of almost anything. So I think it's extremely important. Although I've not read your full bill, I support the concept and I appreciate the question.
Very good. Thank you. I appreciate the answer. Dr. Grimm, according to the NIH, diabetes is a common risk factor for peripheral arterial disease, or PAD, a circulatory deficiency that leads to blockages in the blood vessels that supply the lower extremities. Native Americans experience both diabetes and PAD at a disproportionate rate. And in certain regions of the U.S., Native Americans are more likely to undergo a PAD-related amputation than Caucasians. Patients who undergo amputations have shorter life expectancies, of course, and exchange independence and functionality for chronic physical ailments, high death rates, and a costly dependency on our burdened healthcare system. However, most of these amputations are preventable if PAD is screened, diagnosed early, and properly managed. And I've actually witnessed a procedure. It's really incredible what we're doing today. Because tribal communities are disproportionately affected by PAD, what steps can be taken to ensure that these communities, even in the midst of a pandemic, have better access to quality care that will prevent such amputations? If you could answer that question, sir, I'd appreciate it.
Thank you again, Congressman. Amputations specifically, I'll talk about in Native communities is higher, as you pointed out. And it's terrible when the disease reaches that state where there's no other way to treat it. Because of the isolation of many of our communities and the ability to get either the specialist for that sort of care or to recruit people to your community to actually work, those are very difficult hurdles to overcome. And just off of the top of my head, and I'm willing to research this further, but I feel like the agency would need more purchased and referred care dollars, those dollars that we use to refer the higher level specialists for care that would help our population. And the other thing that was mentioned earlier too is the approval of the bill that would extend a longer term to the special diabetes program for Indians and also raise the dollar amount on that. That program has done an immense amount to reduce the prevalence and the incidence of diabetes in Indian country. And as you pointed out, that's one of the primary factors that causes a higher level of this disease in our population.
Yeah, it really sounds, this is common sense. I know we could save a lot of money as well because amputations and the care afterwards is very expensive. But it's a quality of life issue. Mr. Chairman, I'm not sure if I have any more time. I don't see the clock, but I have one more question if I have time. Is that okay?
Time. Yes, we do.
Okay. All right, very good. I appreciate it. Ms. Sage, your testimony talks about some of the issues tribes have had in accessing the Paycheck Protection Program, the PPP funding. Specifically mentioned the disparities between tribal businesses and large corporate chains. Can you tell us more about this, and what would you propose to fix the administration of PPP? Now, I know we made some tweaks to it, and they've been very positive, but what else can you add Thank you. And this is for Ms. Page. Oh, excuse me, Ms. Sage.
Thank you for that question, Representative. With that, we will allow multiple entities to apply under one EIN. And that was my answer. Thank you.
Thank you very much. All right, Mr. Chairman, I yield back. Appreciate you holding this hearing. Thank you.
Thank you, Gus. Now, Mr. Butterfield's back, so we'll move to Mr. Butterfield for 5 minutes.
Thank you so very much, Mr. Chairman. Thank you for your patience. You know, I'm very appreciative of technology. I first started this hearing 50 miles down the interstate, and now I'm in my home office. When I was on the interstate, I was on my iPhone, and now I'm on my PC. And so thank God for technology. And thank you, Mr. Chairman, for this very historic hearing. I share the views of all of you that we must pay more attention to the needs of Indian country, and I will certainly do my part. Thank you to the witnesses for your testimony today. I've heard most of it, and it's been very powerful. I thank you so very much. President Nez, and let me just start with you, if I may. In your testimony, you talk about the lack of competition among providers currently serving the Navajo lands and the resulting consequences for broadband access in those communities. Last month, you may know that I introduced the Expanding Opportunities for Broadband Deployment Act, which increases competition, and we know that's so important. It just increases competition and it promotes affordable rates by streamlining the process for receiving universal service dollars. I believe that doing so will not only provide high quality service, but promote competition in pricing as well. How would providing more choices for broadband service in underserved communities impact the Navajo Nation?
Well, thank you, Representative Butterfield, Chairman, members of the committee. Thank you for the question. Here on the Navajo Nation, there is a lack of competition due to the large vastness of our nation. 27,000 square miles of land, sparse population, and really the affordability of connectivity is an issue as well. Folks are going through some hardships right now, not just here on Navajo, but all across the country, and can't afford connectivity. But with your initiative there, we see that competition can be created, and at the same time, tribal governments and their enterprises could be a part of that mix to help bring the cost of internet accessibility down and bring affordable rates to our citizens, which would create more choices and competition. Right now, we have a cellular service company that is offered through the Navajo Tribal Utility Authority, our own for-profit corporation. And with that, is bringing competition between other larger cell service providers. So
I agree that competition is valuable.
It's key, sir, yes.
All right, let me conclude with this. Mr. President, your written testimony begins with a very powerful look back at the injustices that tribal communities have suffered down through the years. We're in the middle now of a societal reckoning right now here in our country, something that is long overdue. And it's very important that those wrongs suffered by other minority communities are not forgotten. And then you go on to discuss the importance of reliable high-speed internet to the cultural preservation of the Navajo Nation. I am very interested in ensuring that traditionally underserved populations can maintain their sense of community. And I know Indian country feels very strongly about this. Not lose touch with the culture and values rooted in their shared history. Can you tell us, sir, in greater detail, why the internet is so important for cultural preservation?
Yeah, absolutely. Thank you for that question once again.
We have 45 seconds.
Yes, sir. And, during this pandemic, I think all tribes, and I think everybody has realized that
in order for information to get out to the public to help in slowing down and stopping the spread of COVID-19, it's important and it's crucial and critical that we have high-speed internet so that information can get out. And that's the same thing here that we're challenging our Navajo citizens, sir, and members of the committee, is that we want to retain and package up a lot of the cultural knowledge of our elders. I said earlier, 66% of those who passed on because of this virus were 60 and above, and our elders are in the most vulnerable population. So utilizing technology to get their wisdom, their knowledge, and to save that information for our younger generation is of utmost
Thank you.
importance.
Thank you, Mr. President, so much. You communicate very effectively. Thank you very much. I yield back, Mr. Chairman.
Thank you, GK. Next, we go to Mr. Flores for 5 minutes. I think he got to unmute, Bill.
Thank you. Sorry about that. I want to thank the panel for joining us today, and I want to thank you for your comments regarding the needs of the Native American community that's been made more urgent by COVID-19. Clearly, each of the issues mentioned today represent a complicated set of challenges worthy of in-depth discussion. Today, I would like to focus on broadband access. And President Nez, let's start with you. I appreciate your detailed testimony. My question builds upon those asked by Frank Pallone and a few others during this hearing. Based on your testimony and the white paper that you released in June, your effort to bring broadband access to the Navajo Nation appears to be hindered not just by piecemeal infrastructure and inconsistent connectivity, but also obstacles created by a number of entities involved in building out broadband service. In fact, near the end of your discussion of broadband challenges, you specifically asked for streamlined rules and regulation to, quote, allow for faster and easier but responsible deployment of towers and communications equipment on the nation lands. The white paper you mentioned several times provides a number of recommendations regarding changing regulations. But for the discussion today, can you elaborate more on the type of challenges that you've encountered as a result of multiple layers of government agency rules and bureaucracy requirements? And can you also provide an example or two of how your efforts have been slowed or detailed as a result? If you can do that in about a minute, that'd be helpful, because I do have one more question.
Thank you, Representative Flores, Chairman, members of the committee. I'll use one example. One example that we have a difficult time in trying to incorporate is a infrastructure corridor here on the Navajo Nation. You talked about piecemeal. We have to get a right-of-way approval for electricity to be run throughout the communities, and then another approval for water, another approval for telephone, broadband, and that's one example of many others that are there, sir.
Okay. Thank you. Let me continue down this same line. One of my priorities, and you've reinforced it today, is to cut down on unnecessary bureaucratic red tape, especially when it creates an inefficient and duplicate process that derails innovation and progress. I recently introduced the Enhancing Administrative Reviews for Broadband Deployment Act, which is H.R. 7349. And among other things, the bill directs the Secretaries of Interior and Agriculture to identify administrative barriers to reviewing the communications use authorizations that are needed to grant permits for communication facilities on federal land. This bill is one of 26 others in a package of bills aimed at achieving exactly the type of streamlining you suggest is needed. So, President Nez, again, based on your work to expand broadband, do you think this approach should receive bipartisan support?
Well, it should get broadband support, Representative Flores. You know, I think the highlight of what's happening, the administration here trying to help, infuse economic and community development, as well as this Congress in tribes, but more so now that all eyes are on tribal communities. And this is happening right in the midst of the most powerful nation, to where 40 to 50% of indigenous people don't have running water. They don't have broadband access. And, we are also, and I'll just conclude by saying this, is that we are also here on the Navajo Nation looking at our own laws too, because we have to reevaluate our own laws. And based on our white paper, the white paper is there for the COVID-19 CARES Act funding. And so that, in a way, is recommending as setting aside certain regulations and policies. But I appreciate the long-term changes that need to occur. And with your bill, I see that some of those changes can be done permanently to help tribal communities throughout the country and get us up to, equal footing with the rest of this country. Thank you, Representative Flores.
Thank you, President Nez. I want to thank all the other witnesses for your informative testimony today, and I yield back the balance of my time.
Thank you, Bill. Next, we're going to go to Paul Tonko, recognized for 5 minutes.
Can you hear me, Frank?
Yes.
Okay, Chairman Pallone, thank you. Ranking Member Walden, thank you. What a great hearing. And to our witnesses, thank you for joining us for what is, I think, an essential hearing. We have heard some shocking testimony today with 13% of American Indian and Alaska Native homes not having safe water and or wastewater disposal facilities compared to 0.6% of non-native homes. Similarly, there is a high number of violations of drinking water standards for those with access. Safe drinking water should be an absolute right for everyone. And so we as federal partners need to figure out just how to do better and uphold our responsibilities. So President Sharp, I believe your testimony mentions the Drinking Water and Clean Water State Revolving Fund. Do you believe these existing programs are able to meet the tribe's needs and address these longstanding water deficiencies? Or does there need to be more dedicated funding or basically reforms that are required for the programs?
It's definitely the latter. We need more funding. There's just simply no way around being able to build what we need to do to provide safe water without additional resources. Thank you for your question.
Oh, you're most welcome. And does anyone else want to weigh in? Any of our other witnesses?
Representative Tonko, this is Dr. Grimm. I would just add that I think the Indian Health Service's current estimate is a $2.67 billion of unmet need across Indian country for water and sewer projects.
Thank you, sir. Anyone else?
Representative Tonko, Jonathan Nez here, chairman, members of the committee. I appreciate dollars going through the Indian Health Services for things like, sanitation facility construction programs. But there are some tribes that have the ability to do their own construction on water lines, and that's self-governance. And, what we noticed about the fundings that came from the CARES Act is that there were programs that these monies were passed through, right? BIA, we had the monies came into tribes, treasury, and what we like for the future of tribes here in the United States is direct funding, not just direct funding for these types of emergencies, but direct funding for the budgets that do get approved every year. And tribes have the ability to govern themselves. So that means they have the ability to take care of those federal dollars and to utilize it for the intent given. Thank you, Representative Tonko.
Oh, you're most welcome. The recently released National Economic Transition Platform, which has been developed by local and tribal and labor organizations and recommends how we can ensure a just energy transition, stated that 75% of the unelectrified homes in the United States are located on tribal lands. So President Sharp, similar to the drinking water question concern, do you believe that this is a case of existing programs being underfunded, or are they structurally deficient to meet the needs and to work effectively with the tribes?
I think the answer is both. as you know, there are many challenges within Indian country, and it's not only the funding and the resources, but as Chairman Nez pointed out, many of the complexities that we face, tribal nations should be able to exercise their inherent powers and authorities to adopt policies. And we need to partner with Congress to also legislate congressional responses to those challenges. So I believe it's both. And again, thank you for your question.
Okay, you're most welcome. And Ms. Thomas, your testimony mentioned the Tribal Energy Loan Guarantee Program, which I believe would be used for those larger scale projects, but it hasn't been used yet despite the high potential for renewable energy development on tribal land. My understanding is that this is a loan guarantee, which would still require a tribe to partner with a bank or lender. If these commercial entities are not willing or prepared to do business on tribal projects, would it be helpful for the Department of Energy to be able to make a direct loan?
Yes, Congressman, thank you for that question. So there's a couple of things happening in the Tribal Energy Loan Guarantee Program. First, in the Loan Program Office, which administers the program, they've created a two-step process that has added a great deal of complexity to that loan guarantee program. NCAI points out that we need to remove some of the barriers that have been created by the Loan Program Office. And so frankly, we don't know that there aren't banks interested in lending money to tribes with a loan guarantee. The application process itself is incredibly complicated and incredibly expensive. So it's been made overcomplicated. Having said that, a direct loan program would also be a good tool to have, just like in the 1703 program, where the Department of Energy does loan guarantees and makes direct loans, or like RUS, where you might make a direct loan. So those tools are all necessary, but one of the key challenges is to reduce that regulatory and administrative process that's been overcomplicated in that program in general.
Thank you very much. And with that, I yield back to the chair. And again, thank you for a great hearing.
Thank you, Paul. Next, we go to Mr. Bouchon. 5 minutes.
Thank you, Mr. Chairman, and thanks to all the witnesses. This is really a very important hearing, and I'm a physician, so I'm going to focus on some of the healthcare stuff, and Dr. Grimm will focus a little bit on maternal mortality. If we've had a hearing on maternal mortality across the United States, and what can we do to decrease the disparity in maternal mortality and morbidity at IHS area hospitals? What can Congress be doing specifically for the Indian Health Service in this area of maternal mortality?
Well, thank you, Congressman. Maternal mortality has improved significantly over the years in Indian Health Service, as has infant mortality. And one of the keys, as I know you're well aware, is prenatal care, making sure that someone gets in timely and making sure that they keep all of their visits. Part of the issue, too, with the Indian population is the high level of diseases within that population. If you take a look at almost any type disease, American Indians or Alaska Natives are in that top part. So a lot of the mothers are high risk in our population. And I really believe that not only for this, but diabetes and other things, prevention is the key. Getting them in early, and sometimes that means there needs to be more providers in a particular area or a bigger clinic. I mean, it's a really complex issue. I know you appreciate that. And so I will stop there to allow you more questions, but really just access to care, prenatal care.
So I think you mentioned earlier, you still have a 25% shortage in providers in the system? In certain areas, you have specialty areas that are really short?
Yes, sir. There was a report done on Indian Health Service a while back that looked at a number of professions and the kind of vacancy rates that they ran. And part of my written testimony talks about some of the things we could do to help recruit or retain people further, ranging from making funds available to tribes for residency programs, loan repayment or scholarship funding, trying to increase those. But yes, it's still extremely high rates across the nation, and it varies by location. Usually the more isolated the more difficult that it is to recruit.
Yeah, I mean, the graduate medical education situation is really a nationwide problem, not just in the Indian Health Service. And it sounds like you've got a similar situation there, more support for residency training. You know, we're finding shortages, particularly in primary care in rural America and Indiana that I represent. Part of that is the things you mentioned, the support for graduate medical education, but also the amount of debt that students are coming out of medical schools with. It makes it very difficult for them to practice in underserved areas where their income may not be as high. So it sounds like you've got that same issue. It needs to be addressed really for the whole country, including the Indian Health Service. I want to move on to the situation with the special diabetes program for Indians. And I know we've been trying to do a long-term reauthorization to get it across the finish line. Can you explain why short-term extensions have been disruptive to tribal communities and why a longer-term reauthorization for SDPI is so important?
I think one of the biggest problems, Congressman, that we have with those short terms are staff. Whenever you get near the end of a term of that funding, everyone in those programs across the whole country start worrying about whether they're going to have a job come, whatever date that program ends. Congress has been good to fund it, year after year. But every time this happens, it's disruptive to those programs and the patients too. So really something that's longer term is much better for everyone involved, including Congress, to not have to deal with it so frequently. The other thing that was brought up earlier in the hearing was that funding has been stagnant for so many years. And you know how medical inflation, as well as general inflation, has continued to rise over the years. That $150 million does not buy near as much as it did when Congress first passed it. So
since 2004, right?
Yes, Congress is asking for a very modest increase, of $50 million to go up to $200 million.
Yeah. Well, I'd like to say, as a healthcare provider, the most important thing for me is quality, affordable health care and access. And I think we have some substantial challenges in the Indian Health Service that we should be able to solve together. And I very much appreciate the committee chairman and for holding this hearing. I think it's a very important subject. And I know that you have substantial support on both sides of the aisle to try to address some of these longstanding problems, which we really should be able to address. Again, for me, it's about access to quality health care, and we need to make that happen for everyone. So with that, Mr. Chairman, I yield back.
Thank you, Larry. Next, we're going to go to our Vice Chair, Yvette Clark, for 5 minutes.
Thank you very much, Mr. Chairman, and I thank our Ranking Member Walden for holding this important and timely hearing on the wide range of pressing issues that our tribal communities face. And thank you to our 5 witnesses for offering your testimony today. Whether you look at the desperate impacts of the COVID-19 pandemic or the recent civil unrest sparked by police brutality across our nation, the past few months have made one simple fact clear. Minority communities in America face countless inequities from all segments of society. This is why I, along with my dear friend and colleague, member of the Energy and Commerce Committee, the gentlelady from Illinois, Congresswoman Robin Kelly, are co-chairing the Energy and Commerce Working Group on racial disparities to examine these manifestations of racial inequity and develop legislative solutions that will improve outcomes among people of color all across our nation. And so in my limited time today, I'd like to focus my line of questioning on the disparities that we've seen in our nation's tribal lands around healthcare, broadband, and energy development. According to the Indian Health Service, Native Americans have life expectancy that is 5.5 times lower than the average American. As we also know that the Indian Health Service on a per capita basis spends only 1/3 of what is spent nationally on patient care due to severe underfunding. Now, with the COVID-19 pandemic, we see similar disparities playing out once again as the virus exacerbates pre-existing inequities in healthcare access and quality. My first question is for President Sharp. Could you please elaborate on these broader health disparities that you mentioned in your testimony? What steps do you think Congress must take to address the systemic inequalities that lead to such disparate outcomes?
Thank you. I so appreciate not only your question, but I must say, just during the course of this hearing, the questions that have been raised, clearly there's a lot of people championing our issues and thinking about these. So I want to thank everyone that's been here this morning. It's quite an honor. And directly to your question, Ms. Clark, I really appreciate that because tribal nations have a very clear vision for getting to the place we are now and that prosperous future that we all see. And part of it is holding the United States accountable to fulfill its trust responsibility, those recommendations that are detailed in the report from the U.S. Commission on Civil Rights. I think there's also another strategy supporting tribal sovereignty to advance our economies the way we envision building a private sector economy within our borders, engaging in international trade. There is a big gap between where we are today and that prosperous future. And part of it is upholding the trust responsibility and supporting tribal sovereignty. But both of those strategies and a Marshall Plan would be very effective. And we look forward to partnering with Congress to see that through the end.
Wonderful. Thank you so much for your response. I'm going to move on to the issue of broadband affordability. According to the FCC, less than half of all households on tribal lands have access to reliable broadband services. This lack of access represents nearly a 27-point gap between non-tribal rural areas and even greater gap when you compare it with countrywide coverage. President Nez, why are so many tribal households not connected to broadband, even in many instances when broadband service is available? And how can Congress ensure that all tribal households are able to afford broadband access and devices needed to connect?
Well, thank you, Madam Vice Chair Clark, Chairman, members of the committee. Thank you for that question. You know, we have, and I hate to say this, and I'm sure you all know that we have high rate of unemployment here on tribal lands. And we are doing our very best to create economic development, community development, job opportunities here on the Navajo Nation. But as the white paper that has been mentioned many times that we sent to secretaries, to cabinet members of this administration, as well as congressional leaders, is that there are certain regulations that hinder and policies and laws that hinder development on tribal lands. And so, you know, even by bringing, I'll give you an example, even by bringing one new healthcare facility into a tribal community could be that anchor tenant that can bring economic development, that could bring in shops and restaurants and other type of businesses around the new facility, as well as bringing in broadband connectivity for not just for the hospital, but for that region and for that community. And so I also wanted to mention too that, you know, specialty care. See, a lot of doctors and nurses have a hard time getting used to, well, in Navajo, getting used to being way out in the rural area. You know, they like to give doctors and nurses that are out there want to have the shops, the businesses to go to. But here in tribal nations, you know, the salaries are not up to par. As you heard earlier, IHS has not been fully funded. And in terms of specialty care, a lot of those specialty professionals are off our nation. So we have to send our patients off the Navajo Nation. And during this pandemic, some of the COVID-19 positive patients we had to send off our Navajo Nation, but in towards like Phoenix and Albuquerque. And as you all know, if you've seen the news, there has been a big spike in patients off the nation around us, like in Phoenix and Albuquerque. So we're fearful that some of our COVID positive patients may be denied to go to these facilities. And so the need to better our healthcare system here through the IHS is very important to us. Thank you.
Very well. I'm yielding back, Mr. Chairman, but look forward to doing a deeper dive with the working group that we've established in committee. I yield back.
Thank you, Yvette. Next, we move to Tim Walberg. 5 minutes. Tim, can you?
Thank you, Mr. Chairman. I think you can hear me now.
Yes.
I get the screen up so I know the 5 minutes that are here. I appreciate the panel here today. It's been very interesting. Would have only been better if we'd had opportunity to have a hearing on the tribal lands themselves and the beauty of those places. President Nez, in your recent white paper, you state that land previously disturbed for any infrastructure construction should have a categorical exemption from NEPA for future infrastructure projects. I have a bill, HR 7378, that would provide a categorical exemption for the deployment of broadband wholly within brownfields, et cetera, those type of sites that are heavily contaminated with former industrial activities. So you have the picture of what site I'm talking about. Would you support this concept as we consider future packages, or are there challenges that we need to consider that you addressed today?
Thank you, Representative Wahlberg, Chairman, members of the committee. Absolutely, the intent of what you're doing is something that we have been advocating for some time on tribal lands, but not just for broadband. I talked about an infrastructure corridor earlier where electrical lines, water lines, telephone lines, everything to be approved with one approval process. And what we're encouraging others to keep in mind, including yourself, Representative Wahlberg, is, with a categorical exclusion, we also would like that to cover building of roads within tribal communities. Much of the work in categorical exclusions have to be done by local communities, and it only has a certain timeline before you have to restart that again. And so we put a lot of money and effort into a lot of these requirements, but yet the law could be changed, and that's what you are looking at with other members. And I appreciate that, and I'm willing to be a part of that discussion. Thank you, Representative Albert.
We'll hope we can move that forward and use land appropriately, and also provide the amazing economic impact that it could possibly be. Let me ask you, President Nez, again, I understand the Navajo Technical University has a wireless tower site maintenance program to help develop tower technicians to deploy and maintain communications infrastructure, and that the NTU can be authorized to engage in partnerships with providers to build these towers. What role can workforce needed for communications infrastructure deployment play in the local economy, aside from connecting members of the nation?
A great question, Representative Wahlberg. And Navajo Technical University is right in the middle of one of the largest communities in the eastern part of the Navajo Nation. And because of internet access, it's hard to get resources and monies to supplement salaries for, as I mentioned earlier, for doctors and nurses and healthcare. There's a hotel going up in that community of Crown Point, New Mexico, and Shiprock, New Mexico, where NTU is. And, I think with what that is being proposed, we could really make a hub community to where goods and services could be delivered there, rather than having our folks during this COVID-19, having our folks leave the Navajo Nation to go to the big box stores and possibly go into some type of discrimination, saying those that live off the nation, saying, well, you're bringing the virus off the nation. And then same thing for our citizens, saying, hey, those visitors may be bringing the virus on. And I think if we can really strengthen our economy here on the Navajo Nation, these types of pandemics in the future, we could really enhance our economy here on the Navajo Nation and tribal communities throughout the country. Thank you.
Thank you. Thank you. I yield back my time.
Thank you, Tim. Next, we're going to move to Kurt Schrader for 5 minutes.
Thank you very much, Mr. Chairman. I appreciate it. And thanks for all our participants on the panel. President Nez, thank you for your leadership. It's tough times. My heart goes out to the Navajo Nation right now. And I actually represent several tribes myself, but for the purpose of my question to you, I want to point out that we have the Chemawa Indian School in my district, and several younger members of the Navajo Nation are participants and students at the school. And I'm very worried, and you talked about it a little bit, about the digital divide. I mean, it's bad to begin with, and with this pandemic, I'm very concerned about different school districts around the country and in my state, and worried about Chemawa, about going to online education. To me, I am very concerned that will only make the educational disparities that much bigger and have unequal education. If you're a wealthy Portland suburbanite, you get a great education because you have access to the internet, you have access to devices, maybe not so much for some of our kids in other locations. So you could describe a little bit your experience working with BIE to expand the broadband access for Navajo students, and during the epidemic in particular, and actually prior to that. Could you just talk about that a little bit, and your concern about the difference in educational attainment, given the fact a lot of tribal folks don't have access to the internet?
All right. Thank you, Representative Schrader, Chairman, members of the committee. Thank you for that question. By the way, my mom and dad graduated from Chemawa Indian School. So yeah,
very good
history here. And with the work that we're doing here on the Navajo Nation, early on this pandemic, as we saw the numbers start peaking all around the Navajo Nation, we got all the schools and resources together, including the state schools. Remember, we have 3 states within the Navajo Nation: Arizona, New Mexico, and Utah. So that was a really difficult thing to do, is to bring state school departments to the table, as well as the Bureau of Indian Education. But we did begin to strategize on putting up hot spots. I use hot spots for our students out there, and for also our citizens, because early on we had a public health order in place to mandate everybody to stay at home, and it was difficult because we're telling people to stay home, but they needed internet access. And so with the Bureau of Indian Education, they are looking at ways to bring online schooling to the forefront, as well as the state schools. Some of the states in Arizona right now are looking at giving options to their parents, 3 options. 1, you want to be in the classroom, 2, at home, or a little blend of the both. But here on Navajo Nation, with the CARES Act funding that we recently got from you all with the approval, we put $60 million or $50 million aside to help out with connectivity to our schools and then to communities throughout the Navajo Nation. Thank you.
Very good. Very good. Dr. Grimm, switch to you here. I'm pretty pleased that the Affordable Care Act actually is now in place. My understanding, it's been a huge boon for Indian country, as well as millions of Americans across the nation. We permanently reauthorized the Indian Healthcare Improvement Act. We expanded Medicaid, key determinant, and yet there are folks here in the United States Congress who want to get rid of the ACA, and some people in the White House perhaps. And I wish you'd just comment a little bit about what that would do to Indian healthcare right now.
Well, that's a good question, and I appreciate it, Congressman. The Indian Healthcare Improvement Act, and I'm sure this committee is well aware of that, is attached and a part of the Affordable Care Act. So every time there are challenges to that act, there are concerns that ripple across Indian country about whether that bill would be severable or not, and saved, or whether we would go through having to try to reauthorize that bill again. When I was director of the Indian Health Service, we'd been trying for several years. I thought this is something I'll be able to do when I'm up there. 5 years, we couldn't get it reauthorized while I was there. So finally got attached to that bill. We were glad to see it, but we knew it was a risky move, but it worked. There's also things within the Affordable Care Act that are specific to Indian country, and I won't go through what those are, but to lose those two would be, devastating to the tribe. So thank you for the question.
Well, thank you for being here. Thanks for the responses, and I yield back, Mr. Chair.
Thank you, Kurt. Next we go to Billy Carter. You're recognized for 5 minutes.
Billy Carter, Mr. Chairman?
Did I say Billy? I'm sorry. I'm losing it. It's been a long day, buddy. I apologize.
It has been a long day indeed.
Going to Savannah.
Well, thank all of the panelists. I really appreciate this. This has been a very good hearing, and I agree with my colleagues in saying that we need to expound upon this and expand this into more than just one hearing. All of this information has been very, very good. Dr. Graham, I want to start with you. It's been said that during this pandemic that we've experienced 10 years worth of growth in telehealth and telemedicine in 1 week. In fact, we went from roughly 11,000 telehealth visits a week to almost over 1 million a week. And I just wanted to ask you, I think that telehealth provides a tremendous opportunity for the tribal areas. And what's been your experience? What's been your experience during this pandemic with telehealth?
Well, you're absolutely right that, this is one of the good things that has come out of this effort is that we have expanded telehealth tremendously across the entire health sector, not just in Indian country. Our health visits in 2 weeks that were telehealth prior to 2 weeks later, 300% increase, and they have continued to increase to specialties we didn't think may be interested in doing it, and providers that are on our staff that said, I never want to do telehealth. They're doing telehealth and they actually like it now. Patients are liking it now. Some of the problem, though, we've talked about the broadband issue, the access. Certain of the telehealth visits, you need to have connectivity. Certain reimbursements, you can get it if you have this, but if it's just over a phone, maybe you can't get it. CMS was good to rapidly waive a lot of items during this emergency. And what the healthcare sector is hoping is that a lot of the things that have been waived to make telehealth easier, gets approved long term. And SEMA Burma has said that they're looking at that. They're going to do it. But the other thing is the reimbursement for telehealth visits lags behind significantly too, just because it wasn't used that much. And so we need those both for Medicare in particular, Medicaid, and also private insurance to be updated if we, after this is over, have some long-lasting effect that telehealth continues. And I hope we do.
Good. And you mentioned private insurance, and I appreciate you mentioning that because we need to focus on that. Obviously, we're going to focus on it at the federal level. We get it now. In fact, this committee has been pushing for telehealth for years, and I don't think there's any other members of Congress than members of this committee who are happy to see what has happened with telehealth, because we, particularly in the health subcommittee, have been pushing it for that for years. I'll ask you, Chairman Sage, the broadband and the high-speed internet, obviously that's very much needed in the areas and on the reservations. Have the tribes been able to utilize the 2.5 gigahertz spectrum for tribal lands?
Yes, we have.
Have you had any difficulties with it, or has it worked okay?
We're still working on, the news about it. At the beginning of everything, there's always something that affects us, but we're still working on different issues and to get it. We have, like the short term of things is using Wi-Fi hotspots. The long term is building out networks using the 2.5 gigahertz. And the big issue is that FCC mapping needs to be corrected. Mostly needs centralized make access undefeated red tape. Thank you for the question.
Okay, good. And just one final question, and I'll open it up to the panel. What are some of the challenges that you've experienced in encouraging the private sector, and particularly private sector construction on your reservations? Have you had any particular challenges with that and really encouraging private sector to, and particularly private sector construction?
Congressman Carter, this is Pilar Thomas. From an energy perspective, one of the biggest challenges the tribes have with attracting private developers and private companies to build projects on Indian lands is a combination of the issue I brought up earlier with state regulatory systems that control the utility regulations, but also a challenge across all of energy development, and Chairwoman Sage, I'm sure, can talk about this as well, is the dual taxation problem that we have. Because as you know, with renewable energy projects, investment tax credits are one of the critical economic incentives. And so since tribes are non-taxable, they can't take advantage of those tax credits. They have to bring in a taxable entity to do those projects. Well, then the state can tax that taxable entity. And so the tribe, it pushes out the tribe's ability to tax or have other tax incentives to attract private enterprises because of a state taxation scheme that can interfere with that economic feasibility of that project.
In other words, it's a tangled web, I understand.
It is.
My time's up, and I'll yield back, Mr. Chairman. Thank you.
Thank you, buddy. Next is Dr. Ruiz, recognized for 5 minutes.
Thank you, Mr. Chairman. This is a good day. It's a good day to finally have an Energy and Commerce hearing solely on tribal policy issues. After many years of requesting one, I'm glad that now under your leadership, Mr. Chairman, that it happened. I'm looking forward to many more, including markups, and will continue to advocate strongly for further hearings in this committee and other committees. There are many important ways that this committee should advance tribal priorities and improve lives, but today I want to focus primarily on healthcare. One issue that is incredibly important to me is the shortage of doctors and providers in Indian country. Without adequate providers, including doctors, nurses, and specialists, Native Americans are unable to access the care they deserve and that the United States government has a trust responsibility to provide. According to the GAO in 2017, 4 out of 8 IHS regions with IHS hospitals had nurse vacancy rates above 22%, including as high as 36%. 3 out of those 8 regions had physician vacancy rates above 30%, including 2 over 45%. Last Congress, Congressman Mullen and I examined this and several other issues as chairs of the Indian Health Service Task Force. That investigation showed that the IHS had a variety of challenges to filling these vacancies, including the following. Many IHS facilities are rural, surrounded by insufficient housing, and have other infrastructure deficiencies that make it challenging for providers and their families to relocate. Lower rates of pay make it harder for IHS facilities to compete for medical school graduates who just invested many years and often hundreds of thousands of dollars in their education and are weighed down by student debt. Finally, there is a shockingly low number of American Indian and Alaska Native students who pursue medical careers. Out of the almost 20,000 medical graduate students in 2017, only 30 were Native youth. That's 0.15% of all students who have graduated. While Native doctors are by no means guaranteed to serve tribal communities, they are more likely to do so than their peers. We know that the 2 biggest factors for where a doctor will practice medicine is where they are from and the last place that they trained. I did this when I returned to the Coachella Valley to serve my own community in terms of creating pipelines with students from underserved areas and creating residency trainings and medical education in those areas as well. As a physician, I know the problems that the healthcare workforce shortage create. It means that Native Americans have to wait longer and drive further to get care. It means that many of the underlying social determinants of health are exacerbated by the lack of access to preventative care and early treatment of disease. We must improve the educational pipeline by increasing the awareness and interest in pursuing careers in medicine among Native youth. Dr. Grimm, my first question is to you. Do you agree that helping and inspiring more tribal youth to pursue medical education is an important step to solving the long-term provider shortage?
Yes, sir, I do. I think it starts early, and a lot of studies have shown the earlier in the pipeline you can do that, the better. Having medical schools that are close to tribal lands also helps, and having residencies on tribal lands. Oklahoma State University Center for Health Sciences is opening up a medical school this year at the Cherokee Nation in partnership with them. There are 3 tribes in Oklahoma, and the Chickasaw are one of them, that have their own family practice residencies.
Great.
And we're ours on our own. We haven't been able to get a grant, for the teaching health centers through HRSA.
Great. Well, we definitely need more of that. That's why Chairman Pallone and I introduced a package of bills that included H.R. 4534, the Native Health and Wellness Act, which would create a grant program for tribes to recruit and mentor Native youth for medical professions. This bill will lead to more doctors who can serve their communities. Dr. Grimm, other than increasing pay, what are your top recommendations to shrink the provider shortage in Indian country in the near term?
Well, 2 of the things that you mentioned in your opening comments, which I thought were great, are loan repayment programs and scholarship programs. If we could make more funding available for both of those things to Native youth, but to any doctors that are coming to Indian country, I think that would be a great, great help.
Thank you. And then the final question, can you speak to how proactive investments, like investing in the Indian Health Service, making sure that we have more public health outreach programs like the Special Diabetes Program, perhaps even creating more funding programs for mental health, public health within Indian Health Service is beneficial to Indian country?
Yes, sir. If somebody doesn't have access to care or doesn't have access to preventive services, they just flat aren't going to go. And the longer they wait to get care, the worse their condition gets. There are certain conditions that get better over time, if you do nothing at all, but there are others that continue to get worse. And we are sorely underfunded in all those areas you talked about, especially mental health too. Huge needs in Indian country for behavioral health issues, mental health, alcohol and substance abuse. Great, great needs. And part of the problem to fix it is making more dollars available in that particular line item of the budget.
Thank you very much. I yield back my time.
Thank you, Raul. Next, we go to Annie Custer, recognized for 5 minutes.
Thank you very much. Thank you, Mr. Chair. Delighted to be with you all. And thank you so much to our witnesses for being with us. This is an incredibly important conversation, and it's long past time for Congress to address all of these challenges: healthcare, telecommunications, energy, and water, even before COVID-19. But now we've seen that they have further exacerbated the inequities faced by our tribal communities. I'd like to address an issue that we haven't discussed that ties into the rates of sexual and domestic violence in Indian country and the alarming rate of missing and murdered Native women, which is truly a national tragedy. It's a stain on our country that these incidents have persisted for too long and all too often without justice being served. And I'll just say this is a deeply personal issue for me. I'm a survivor of sexual assault and now the co-chair of the bipartisan task force to end sexual violence. Last fall, our task force held a very emotional roundtable on this topic, and I want to thank Congresswoman Deb Haaland and members from both sides of the aisle that joined us to hear from tribes as far away as Alaska and across this great country. We heard heartbreaking stories and staggering statistics. The scope of this crisis is truly disturbing. So I'm proud now to support legislation to enable tribes to arrest and prosecute non-native perpetrators, to expand protection orders, and to establish new law enforcement protocols and resources. But it's clear to me that Congress has a long way to go. And I want to ask about what more this committee can be doing to help. My first question is to Dr. Grimm. Year by year, we continue to learn about how survivors process trauma and what kind of treatment they need for their own mental health. In some cases, this pain compounds upon the historical trauma that people in Indian country can feel from their people having been systematically oppressed for generations. So over your years with the Indian Health Service, have you noticed that the system is being more responsive to the emerging science like trauma-informed care for survivors? And is there anything that you could add how we could help to implement these strategies?
That's a great question, Congresswoman, and I appreciate your leadership on this issue. Yes, over the years, as the science has evolved, the IHS has adopted it. And one of the great things about Indian Health Service, I think, and tribal health programs is whenever research starts showing things, we can really spread it across our system very quickly. I'm sure many of you have heard the adage that, when something gets proven in research, it may take up to 13 years to end up in practice. But especially for problems like this, when new research and new treatments come out, the agency has been doing a lot of trauma-informed care training with their staff. And I hate to keep saying that it goes back to money, but, having the availability of these services in areas, the vacancy rate issue that we talked about, all these compound the already difficult nature of dealing with some of these problems, So I appreciate what you're doing. I appreciate, you staying on top of this, and we'll do anything we can to work with you on it. It's a big problem in Indian country.
Thank you. Just before I close off, do you see in the near term an opportunity for Congress through the CONNECT Act to leverage telehealth solutions to help survivors, particularly in those remote areas that we've talked about? And are there any other healthcare barriers that need to be addressed, such as access to telehealth?
Yes, to all that. There are barriers to telehealth. Some of them are the broadband issues we've been discussing, and I'm not an expert on that area, but I support everything that has been said, and our tribe is doing a lot on that front to try to help. But telehealth for behavioral health issues actually sometimes is more acceptable to the patient than coming in and talking to people face to face. This rapid change to telehealth during this time, we have had so many patients and our providers tell us, especially for behavioral health services, that people are more accepting of it. They like it. In fact, they want to continue to do it when, the crisis, the pandemic is over. So anything that we can do to make that more available. Part of that is getting this broadband network out. Part of it is the equipment. Sometimes there's special equipment. Sometimes it's just a phone. But anything we can do to enhance telehealth, I think it goes particularly well in psychiatric and behavioral health circles.
Great. Well, thank you so much for being with us. My time is up. I yield back.
Thank you.
Thank you, Annie. Next member is Lisa Blunt Rochester, recognized for 5 minutes.
Thank you, Mr. Chairman, and thank you so much to the witnesses. This is a very important hearing, as many of my colleagues have stated. In Delaware, I represent our two state recognized tribes, the Nanacoke tribe and the Lenape tribes. And, just being able for people to have a voice and to be heard is important and particularly when they are the people on which this country, it is your country. It, and I think all of us take a moment in this hearing because it is a pivotal one. We know that COVID-19, the pandemic, has shined a light on systemic, ethnic, and racial inequities that course through our country. And these disparities have caused communities of color to really be disproportionately affected, and particularly in tribal nations. And I've always believed that there's an inextricable link between the environment in which people live and their health. This pandemic has underscored that reality. And one example is our country's clean water infrastructure. In Delaware, from 2000 to 2014, we saw an increase in communities lacking access to clean water and sanitation services. It is no wonder then that these same communities are having higher infection and death rates from COVID-19, where one of the best ways to guard ourselves against this disease is by washing our hands with clean water. This same trend is happening throughout the country's tribal nations, and it underscores a larger problem where these communities lack access to a basic human right, water. My first question is for President Nez. You mentioned in your testimony that some members of the Navajo Nation haul water for more than 50 miles from more than 50 miles away. And I read another article that talked about donations of bottled water being distributed by volunteers in coordination for the response for COVID-19. Can you discuss the sustainability of these practices and the continued impacts on health, human health, and the environment to communities that lack a sustainable water infrastructure?
Thank you, Representative Rochester, Chairman, members of the committee. Thank you for that question. We do appreciate the Friends of the Navajo Nation that have stepped up and helped during this public health emergency here on the Navajo Nation, this pandemic. And, we waited 3 months for the CARES Act funding to come to tribes. And 3 weeks ago, we finally got the last allocation of that. And so we had to rely on the Friends to bring bottled water. And we're in a drought as well here on the Navajo Nation. We just got a report from a forest fire here, Wood Springs 2 forest fire that just ravaged our lands, and over 12,000 acres burned and 76% contained. So there is a drought here, and then on top of that, you got this public health emergency and CDC guidelines saying to wash your hands with soap and water, and people just can't do it. They haul water from various places, and even the water that we drill for right now could be contaminated with arsenic and uranium. As many of you know that are on the committee, we have over 500 uranium mines still open here on the Navajo Nation that are still being cleaned up. And those were during the Cold War era. And so during the Cold War era, the Navajo Nation helped out in 2 ways. The resources here by gathering uranium and putting them into weapons. The second is also our language, our Navajo code talkers. And I'm sure many of you know about the history of our code talkers. But in terms of water, it's very important that we, get Navajo Utah Water Rights Settlement Act approved, Arizona water rights approved, so that we can get clean drinking water to those 30 to 40% of our Navajo people that don't have running water. Thank you.
Thank you, Mr. President. I have so many questions for so many of you, and my time is out in 20 seconds. But one of the areas that hasn't been touched upon that I did want to ask about is people with disabilities. I served as Secretary of Labor in Delaware, and also in another job got to work with KNAR, which is the Consortium of Administrators for Native American Rehabilitation. And as we talk about health disparities and issues related to health, mental health and physical health, and jobs, rehabilitation services are going to be important as well. So hopefully we will have an opportunity to talk about people with disabilities who come from Indian country as well. Thank you, and I yield back.
Thank you, Lisa. Let me just mention, because I've been given some emails. What I have now is, since there's no Republicans, I have the order as Kennedy, Cardenas, Kelly, Nanette Barragan, O'Halloran, and Vesey. Now, that's assumed that none of the Republicans come back. So next is Mr. Kennedy for 5 minutes.
Thank you, Mr. Chairman, and thank you to our witnesses for being here for a critically important hearing. As some of my colleagues have mentioned, this pandemic has become a diagnostic die, tracing through our system and exposing deep inequities and injustice across our society. Indian country and tribal lands have obviously been no exception. But we knew long before COVID-19 first entered our communities that systemic underfunding of healthcare on these reservations was having a devastating consequence for the health of Native Americans across our nation. We can't be surprised after centuries of mistreatment of tribes in this government's name. But now, as cases of COVID-19 reach historic highs on a daily basis, we need to act quickly to learn from our mistakes and protect the people that we serve. So, President Sharp, I wanted to start with you. Can you describe whether IHS was able to, in your opinion, disperse CARES Act funding in a timely manner while respecting the consultation process?
With all of the delays and barriers and appropriations, we did not gain access quickly enough, and nor did we gain access to the resources, but working through IHS to try to gain access to the National Strategic Stockpile was also a barrier. So in terms of providing resources and equipment, there were many delays that cost lives.
And did you report, just to flesh that out a bit, did you end up receiving supplies of PPE and other critical devices, or no?
No. Here in the state of Washington, when we sought to seek PPE, we were told that a good part of that was going to be deployed to the Seattle-King County area where the first nursing home was an impact. So not only are tribal nations, by virtue of being tribal nations, have barriers, but because we're in remote communities, we still have additional barriers in accessing PPE.
So it's clear that there are those barriers and so many challenges that are affecting Native Americans and ultimately health outcomes and quality of life. One particular issue is the availability of healthcare workers, with shortages of physicians and nurses impacting the provide. What's been your perspective on this shortage, Madam President, and what immediate actions need to take place in order to address this gap in the short term?
The shortage within my own nation, and I could speak from personal experience as a tribal leader in dealing with the pandemic, we actually had to reach out to the Washington State National Guard to deploy the necessary resources and partnerships to conduct the testing. We had over 1,000, 30% of our population, but the number of staff and personnel that we had, it was simply just inefficient and insufficient to meet the need.
Thank you, Madam President. Dr. Grimm, I wanted to turn to you. Telehealth obviously has been critical during the pandemic. Even during normal times, it can lower the cost for providers and for individuals. In one program, Telehealth created a $12 return for every dollar spent on providing basic clinical services in the underserved populations. However, inadequate broadband infrastructure means that telehealth opportunities are limited for those who need it most, including those on tribal reservations where under half of tribal residents have access to fixed broadband. So I was hoping, Doctor, that you could share how telehealth would improve healthcare outcomes for tribal residents, and what are the main barriers of access to telehealth for Indian country?
Thank you for that question, Representative Kennedy. I think one of the biggest barriers we've talked about a lot on this hearing is broadband access. For everyone to have access to that. And it's just been exacerbated, with COVID, when you can't go into your doctor's office or you can't go into the hospital unless you're really sick. We converted things rapidly all across the nation, and people have done the best they can. And I think this just pointed out some of these needs, for that last mile of coverage to get to places, or in President Nez's case, sometimes it's a lot more than the last mile. But the other thing too is the funding, the reimbursement for telehealth services. For some services, it's okay, it's good. For others, it is way behind what it should be today. And I think that was, because as one of the former representatives said, we weren't using telehealth that much, no matter how much we tried to push it for years. And now that now that people are seeing how useful it is, how good it is for so many services, I think it will continue beyond this. And so we're going to have to fix some of these things that we've discussed in the hearing today.
Sir, thank you very, very much. President Nez, just very briefly, the cost of access to broadband far outweighs the cost that most residents in tribal communities can afford to pay. HR 2 provided a $75 subsidy for tribal residents to afford broadband. Just briefly, can you talk a little bit about what those subsidies would mean for
Well, thank you, Representative Kennedy and Chairman, members of the committee there. That subsidy would help get fast, high-speed internet capability to our students, to our workers, as well as those most vulnerable populations so that they can have telehealth at their homes. Thank you.
Thank you. I yield back. Thank you, Chairman.
Thank you, Joe. Next is Tony Cardenas for 5 minutes. I think you're okay.
Okay.
Tony.
All right.
Yeah.
Let me move it over so I can see the clock. Okay, there you go. Thank you very much. And I appreciate this opportunity for our committee to have this hearing and meet with the leaders of nations. Thank you so much for coming forth and representing all the people of Indian country and all the needs that persist out there. I have the right, and I believe the responsibility, to take this opportunity to apologize on behalf of the United States Congress and for the past opportunities that we passed up to have this hearing. And I personally believe, and I don't want anybody to assume that I'm speaking for other members of Congress. They can concur with me if they choose. But I personally believe that the efforts of genocide on the first Americans has never ended, in the sense that for us as a country to chronically ignore that in Indian country, you have the worst conditions on your tribal lands of any other people in the United States of America. And for that to be ignored and that not to be attended to by presidents of different parties, it's not a partisan statement I'm making. I believe it's a fact. And I want to make something very, very clear. I say this from my heart, and I say it as an honored member of the United States Congress, that I do not say this out of pity, or I would not believe for 1 second that any of you came here today for anybody to feel sorry for you. I believe that I say what I say because it is only right that we state that in public record. And that I believe that you are here to represent, as you've been elected, duly elected to represent your nations. So with that, I'd like to open it up for an opportunity for you to share, if you will, how you feel about being the most ignored and disrespected community in our land. And the numbers prove out that when you look at the disparities of healthcare, when you look at the morbidity rates, when you look at the rates of death by babies who are Native American, et cetera, you are, if not at the top of the list in every category that no one wants to be at the top of the list of, you are. And United States Congress has the power of the purse. And yes, whoever is the president at any moment has the responsibility of administering everything of this relationship between the United States of America and your nations. So if you would please take this opportunity to express how you feel about this relationship and what is lacking in this very important relationship that determines life and death with your people. Thank you.
Representative Cardenas, thank you for those words, and thank you, Chairman, members of the committee. And, on behalf of the Navajo people, your heartfelt apology, I, as an individual, as a president, accept that. But we need the whole entirety of Congress to do the same, and where to start, right? There's just so many places. But if you look at the Broken Promises report, these were sacred promises that were given or been made by one sovereign to another. And treaties are that foundation of our relationship. I mean, we were here since time immemorial, but that relationship, should improve because of this committee hearing today. On the Navajo Nation, there are 9 emergency rooms, 27,000 square miles of land, equivalent to the size of West Virginia, and yet we have only 9 emergency rooms. Indian health services need to be fully funded. We need to be able to support the tribes in taking over their health care facilities. And that's just based on what we've gone through this pandemic. And there's just this long list of other items that we could say. So thank you so much for your heartfelt apology, sir.
Thank you, Congressman. And with 10 seconds, how do I feel? I feel that tribal nations have an effective death sentence. If the scale of this pandemic continues to climb, and looking at the images coming out of Italy and Spain, when I saw people just left to die in their homes, left to die in the gurney, I saw Indian country. We don't have the resources. We don't have access to PPE. So how I feel, we have an effective death sentence right now facing this pandemic.
Tony, are you?
Thank you, Mr. Chairman. I appreciate this opportunity, and I look forward to working with all of my colleagues on both sides of the aisle to rectify these wrongs that have been so chronic and so persistent for hundreds of years and for generations. I yield back. Thank you.
Thank you, Tony. Next, we go to Robin Kelly, recognized for 5 minutes.
Thank you, Mr. Chairman, and I thank the committee for bringing us together to discuss this critical issue that everyone agrees we should have been discussing a long time ago. So thank you for bringing us together. COVID-19 has laid bare long-standing issues related to tribal data collection and sharing. Federal agencies claim that tribes do not fully report demographic information and that certain privacy restrictions prohibit data sharing. Meanwhile, tribes note legitimate sovereignty concerns. Without access to standardized data, it can be difficult to understand the impact of COVID-19 on tribal populations. Some organizations and local health departments may even collect data without listing American Indian or Indigenous as an option. Tribal data could be lost in a very expansive other category. Dr. Grimm, what recommendations would you have for IHA or CDC on how they can work together to improve the quality and quantity of tribal public health data, both during and after COVID-19? And I'm the chair of the Congressional Black Caucus Health Brain Trust. So we've been very active on getting racial data, and it was included in the last bill. But still, when the report came out, it was not good at all and had very little meat to it. So how can we make sure that the data from the tribal nations is included, because data informs policy and resources and programs?
Thank you, Representative Kelly, for your leadership and for that question. One of the things that you mentioned has been a big problem over the years is the lack of American Indian or Alaska Native being included in sufficient numbers in surveys across the country so that we could use that data. And a lot of times, this was when I was with Indian Health Service. I don't know if it's changed, but a lot of times the agency or individual tribes will pay a company who's doing, those big surveys to oversample. They call it oversampling the Native population, so we have enough data to be comparable to what they're using those surveys for. So I think ensuring, that that is always happening, for the population, not that it has to be an afterthought, that it has to be paid for separately by some Indian specific agency, but whenever things are being done, that it be done is just a matter of course. The other thing with the Indian Health Service, it's a huge issue right now for all of tribes and all of the federal sites, is our aging electronic health record. A lot of the data that comes to the Congress, from Indian Health Service comes from that electronic health record, both clinical data and statistics, as well as public health data. And so right now, the DOD and VA are making a big change in electronic health record. Indian Health Service is the third, federal entity that has a big health service, and the agency is working on a plan, but it's going to be an extensive expense. In my testimony, I said $3 billion. That's what the estimate is right now to get a new electronic health record. I would say between those two things, that would go a long ways making things right in the way of data.
And the other question I have for whoever wants to answer, it's about vaccines and clinical trials. I know in the African American community, they were left out of clinical trials so much, but now don't have the trust because of different things that have happened. And I don't know, President Nez, if you want to answer the question, how do we get tribal community involved with clinical trials?
Yeah, appreciate the question, Representative Kelly, Chairman, members of the committee. Yes, you hit it on the nail in regards to trust. I mean, folks have taken advantage of tribal communities, including the federal government. And, just look at what happened with the information that we forwarded to the U.S. Department of Treasury. There was a breach of information there. And now it's all over the world. And, that's not helping in restoring trust here. And, I think I also heard from Chairman Pallone that I've heard a lot about bipartisan earlier, but I didn't hear anyone from the Republican side being on this committee today. And that just shows that there is a lack of attention coming from the other party, and the seriousness in reconciling the relationship between the federal government and others. So thank you so much.
Thank
Mr.
you.
Chairman, point of parliamentary inquiry.
Mr. Griffith, yeah, I hear you.
I just want to have the chairman acknowledge that there are Republicans that have been in the committee most of the time, and for a big period of time. I see Tim Walberg has turned on his camera. Some are listening to it, but many of us have participated, and I just want to set the record straight.
Right.
Thank you. Now, where were we? Whose time was it? Robin?
Yeah, my time's up.
You're done? All right. Thanks a lot. Next is Ms. Berrigan. Nanette, recognized for 5 minutes.
Thank you, Chair Pallone, for holding this hearing on addressing the urgent needs of tribal communities, whether it's broadband access, energy and water security, environmental injustice, or public health disparities. The United States has a long way to go to address the challenges facing tribal communities. We have unfortunately seen during COVID-19 how harmful longstanding inequities are. It will take bold investments and policy solutions developed in partnership with tribal governments and Native communities to make progress. So I appreciate the opportunity for us to talk about this today. Ms. Sharp, my first question is going to be for you. There are over 500 Superfund sites across Indian country, making up more than a quarter of all Superfund sites in the United States. Over 80 are on the national priorities list. This environmental injustice causes serious harm to the health of tribal communities from the ongoing air and water pollution caused by these toxic sites. Ms. Sharp, how can we do a better job of empowering tribes and engaging in consultation with tribal governments in the Superfund cleanup process so their needs and views are prioritized?
Thank you. I could simply answer that question by suggesting the United States takes bold action to implement international standards set forth in the UN Declaration on the Rights of Indigenous Peoples with respect to free, prior, and informed consent. Throughout the years and facing many of these Superfund sites, we engage in consultation, and up to this point, it has seemed as though it's an administrative exercise to check the box and proceed with unilateral predetermined action. But if there's to be any meaningful relationship between the United States and tribal nations when it comes to Superfund sites, sacred sites, they must take into consideration not only our views, but those views must be decisive and determinative in the outcome that directly impacts our lives, our lands, and our people and resources.
Well, thank you, Ms. Sharp. We've also heard from advocates that the EPA action on the Superfund cleanup is slow. However, when the EPA does take action, they often take the lowest cost option, such as covering up toxic substances instead of removing them from a location. These toxins then persist in the environment and still cause harm to our tribal communities. Do you have any advice on how Congress can improve the Superfund policy to ensure a cleanup actually removes the harm from the community?
Yes, I could answer that very broadly. Courts are now starting to consider climate-related impacts to regulatory and permitting decisions. Up until this point, climate-related impacts are not on regulatory checklists, although scientists are now finding that those impacts should be taken into consideration and factored. And so we need to look at our environment holistically and look at new and emerging science, best science, and make sure that we are in line with the court decisions. Because if it's up to judges to force public policy to be responsive to climate change, that means there's still work to do in Congress to address those very critical needs.
Thank you. And Mr. Nez, when it comes to the climate crisis, we know environmental justice communities are hit first and worst by drought, flooding, and other impacts. Can you speak to some of the impacts the Navajo Nation is experiencing from climate change and what investments Congress can make to help with adaptation?
Oh, thank you again, Representative Barragan, for the question. Chair, members of the committee. Let me go to your comment on the Superfund funding that is available there. We as tribes have to apply for these fundings in a competitive way. And we recently tried to apply for some Superfund dollars, and we weren't successful. And so we have to wait till the next available grant cycle in order to get funds that can clean up some of these sites here on the Navajo Nation. And so what I'm saying here is we need to be able to get direct funding to tribes to help. And I'm using the example of the 500 or so uranium sites that are still open here on the Navajo Nation. And those need to be cleaned up. And as you all know, and Assistant Speaker mentioned earlier, the downwinder bill, some of these uranium mines are still open, and we get a lot of wind here, and the uranium particles, excuse me, do go into the atmosphere, and we wonder why we have high rates of cancers in our area, and that could be one of many reasons why people get cancer here in the Southwest. Thank you, Representative.
Thank you, sir. And with that, I yield back, Mr. Chairman.
Thank you, Nanette. Next, we have Tom O'Halloran. You're recognized for 5 minutes.
Come on.
You're good.
I'm good? Okay. Thank you, Mr. Chairman and Ranking Member. I first want to thank the chairman for keeping his promise and making sure that this hearing was done. You made that promise publicly a number of months ago, and really appreciate it. Secondly, clear up a couple of things. We have a bill that will drop tomorrow on the extension deadline for the COVID money that was given out to the tribes. We also have a bill. I want to thank the chairman and the ranking member also for leading a bipartisan GAO letter to identify IHS needs on tribal nations for different types of facilities. I'm going to request, and I've been working with staff to do that also for the COVID conditions that are out there, and to see how IHS has worked on those. Additionally, we have a bill out there already on graduate medical education. for tribal and rural areas in the United States. So I'm looking forward to that. Now, I had a whole list of things, but the treaty and trust obligations of the United States of America. And I just want to point out a couple of things. We've talked a lot about healthcare and others, and that's extremely important. But the Navajo Nation 40 years ago had the Bennett land freeze, where a large section of the reservation could not be changed. No new businesses, no changing of your house, nothing. And that's not resolved yet. It's resolved not as far as funding to get that resolved. The uranium mining, the president brought that up. I talked to EPA. There's not one of those 500 and some sites that are safe. And we've known that for 70 years that this is going on. Unemployment, I represent 12 tribes. Unemployment rate ranges from 40% to over 80%. That's before COVID. Just imagine what it is today. Police on Navajo, there's probably about 205 or 4 of the police officers on the street around the clock in an area, the state, the size of West Virginia. You get the sense here that I could go on and on, but I want to ask a couple of questions of President Nez, Yate President Nez. In your testimony, you mentioned HR 7056, legislation that Congressman Don Young and I introduced to authorize much needed funding for the Indian Health Services Sanitation Facilities Construction Program. Can you explain how this would improve the lives of elders in remote communities like Hard Rock Chapter? Do you think adequate funding for the program will reduce the spread of COVID-19 by allowing elders to follow CDC guidelines and wash their hands with soap and clean water? The second one is there a piece of legislation currently before the House that would immediately help the Navajo people if passed?
Thank you, my good friend Tom O'Halloran, representative and chairman, members of the committee. Those questions I have spoke about earlier in terms of getting needed water infrastructure to our citizens. And again, 40 to 50% of our Navajo citizens don't have running water. And so it's critical that we get water to our Navajo people. And through this drought, you know, in our way of life, in our culture, and many of you may be ranchers, you know that our animals are important to us for providing for our well-being as well. You know, we sell our livestock to make pay for things. And here, being in a drought, you know, with what Representative O'Halloran is pointing out, is to get monies into the IHS for watering points, not just for drinking water, but also for our livestock here, because a lot of times we have to go 50 plus miles to haul water. And so it's critical at this point. Again, no vaccine, no cure for COVID. We don't know how long this is going to last. And we need to get running water to our Navajo citizens, especially those in the rural parts of the Navajo Nation. And thank you so much for being a champion, Representative O'Halloran, on the Special Diabetes Program, SDBI. And, you know, that funding has lessened the rate of diabetes throughout the tribal communities. Thank you.
And Mr. Chairman, I think my time is probably up, so I will yield.
Thank you, Tom. And next I see Mark Vesey. You're recognized for 5 minutes. Can't hear you yet, Mark. I think you're on mute.
There we go, Mr. Chairman. Can you hear me?
Yes.
Thank you very much. Appreciate you holding this hearing today, and I want to thank all the witnesses for taking the time to be here as well. I don't, it's really been amazing to me to just watch the news over the last really month or so, because we're learning more and more about how our tribal communities in this country are being affected. At the very beginning, we didn't hear much about them at all, but as COVID continued to wreak havoc on the country, we finally started to recognize just how worse it's even been in our tribal communities, and we really have to be able to provide some sort of relief to these communities. We've talked a lot about healthcare and energy and education and environmental issues, but in my opinion, and you've heard this term a lot, we have to get to the root of the problem and start talking about some of the systematic inequalities that have held Indian country back and really put them in the space that they're in right now, which is obviously very dire. And so I just want to ask the panel, in 2013, President Obama established the White House Council on Native American Affairs through an executive order to ensure that the federal government engages in a true and lasting government-to-government relationship with federally recognized tribes in a more coordinated and effective manner, including by better carrying out its trust responsibilities. Under the Trump administration, this council has been ignored and was only reestablished in April after COVID-19 had already started wreaking havoc and devastating Indian country. And my question to the panel is, are you aware of whether the White House Council has held a principal level meeting yet, and if representatives from your tribes have been invited? Anyone on the panel from Indian country, please.
I'm not aware of any engagement, nor have I received any invite to participate.
Thank you. Another panelist?
Yeah, thank you. Go ahead. I'm sorry, go ahead. Christine.
Thank you for this question and for this comment. And for Southern U, we have not been aware of this also. So there needs to be attention drawn to this, and hopefully you can do that.
Thank you.
Representative, yes, Representative Vise, thank you. And Chairman, members of the committee. The 2013 White House Council of Native American Affairs was very critical in getting all the information from the tribes to the White House, because those members on that council were secretaries of various departments. And so when we're talking about the white paper about seeing how these secretaries would be able to waive or set aside certain regulations, this could have happened if that council was established. And I understand, yeah, it was reestablished in April, but to this day, I haven't heard any invitation other than what was brought up earlier about the missing and murdered Indigenous relatives of ours being in the forefront. But when it comes to policy and regulations that deal with community and economic development, I haven't heard nothing. Thank you.
Do you think that if the White House, if President Trump were to fully revive this committee, do you think that the council could provide more inclusion and transparency for tribal communities and better ensure that they have a seat at the table when opportunities are made available for state and local government?
Absolutely, Representative. We as tribal leaders throughout the United States have advocated that there should be a tribal leader on this council. And I know that towards the end of the term, it didn't happen for the previous administration, but that request is also being forwarded over to the White House. We need tribal leadership to be at the table on a lot of these discussions. And I bet if they were to do that, a lot of coordination can happen. Communication it would be a lot easier for them because these will be secretaries of each of the departments.
to make decisions on behalf of Navajo or Native American citizens. Thank you.
Thank you very much. Mr. Chairman, I yield back.
Thank you, Mark. I think that concludes the questions, unless I missed somebody. I don't think so. So look, I want to thank all of our witnesses. I thought this was really worthwhile today. We don't have too many full committee hearings, and the reason we did this was because the issues basically, go across all of our subcommittees of jurisdiction, and so that's why we wanted to do a full committee hearing today. And certainly, you all gave us some very good ideas, as did the members, about where we need to go from here, legislatively, investigatory, and otherwise. And we're certainly going to follow up. So I want to thank you all sincerely and thank all the members. We had almost every member of the committee participate today. I do want to request unanimous consent before we conclude to enter into the record the following documents: a statement from the Alzheimer's Association and Alzheimer's Impact Movement, a statement from the Robert Wood Johnson Foundation, a statement from the Internet Society, a statement from Representative Deb Holland, a statement from Public Knowledge, a statement from the National Indian Health Board, a statement from the American Psychological Association, a statement from the National Council of Urban Indian Health, a statement from the Columbia River Intertribal Fish Commission, a July 2020 letter from Upper Mohawk, Inc. to myself and Ranking Member Walden, a 2020 letter from the Navajo Nation to the President, to President Trump, a statement from the Confederated Tribes of the Colville Reservation, a July 2020 report from the Department of Energy Office of Indian Energy entitled DOE Indian Energy Program Overview, Tribal Energy Development and Deployment, and finally, a July 2020 presidential message on the 50th anniversary of the federal policy of Indian self-determination. Without objection, so ordered. I do want to also remind members that pursuant to committee rules, they have 10 business days to submit additional questions for the record to be answered by the witnesses who have appeared. And I would ask each witness to respond promptly to any such questions that you may receive. So unless anyone has any other business at this time, the committee is adjourned. Thank you all.